Thank you, my colleagues. We've returned from recess. The Committee on General Government Operation, Appropriation, and Housing has returned from the recess. Thank you to the people of Guam for listening on and for your patience. Senator Castro, you have you brought to my attention that you would like to reconsider the amendment that was passed. Would you please speak to that?
Mr. Chairman, thank you for that opportunity. Based on a communication with the Oversight Chair, Senator Talahi, she advised that my amendment that was earlier passed by the body may in fact jeopardize the opportunity for reimbursement using CARES Act funding. I provided a copy of the CRF for tribal territories and states, but notwithstanding that, I'd like to move to reconsider, and then I'd like to withdraw my amendment.
All right, we will, there's a motion to reconsider the amendment to the amendment. Would anybody like to discuss that? Other than that, I would have a roll call to make sure that we're in line. I don't see any hands waving. Joe, go ahead and Senator Therese.
Just, yeah, very briefly, I'm not the expert. I called Art St. Augustine, the Director of Public Health, asked him if he thought it would have an impact as Senator Sabina Perez had suggested. And he said he was not sure, but that they will cover whatever they needed for tracing, testing, and all communicable disease prevention through the general language that was already in the amendment. And that, but he's very, he just doesn't want to affect that supplant. I think that's remember the one we talked about with you, the supplant kind of grants. That's all. Thank you.
All right. Okay, Joe, let's take a roll call on the reconsider.
Thank you, Mr. Chair. On Senator Castro's motion to reconsider, Chairman St. Augustine?
Aye.
Chairman St. Augustine, aye. Vice Chair Rigel?
Aye.
Vice Chair Rigel, aye. Vice Chair Shelton?
Again.
Vice Chair Shelton, aye. Speaker Munya Barnes?
Again.
Speaker Munya Barnes, aye. Senator Lee?
Again.
Senator Lee, aye. Senator Therese Talahi?
Again.
Senator Therese Talahi, aye. Senator Peter Talahi?
Senator Pito, please turn on your mic.
Aye.
Senator Peter Talahi, aye. Senator Marsh Titano?
Again.
Senator Marsh Titano, aye. Senator Castro?
Again.
Senator Castro, aye. Senator Moylin?
Aye.
Senator Moylin, aye. Senator Munya?
Again.
Senator Munya, aye. Vice Speaker Nelson?
Again.
Vice Speaker Nelson, aye. Senator Perez?
Again.
Senator Perez, aye. Senator Torres?
Again.
Senator Torres, aye. Senator Taitugui?
Again.
Senator Taitugui, aye. Mr. Chair, you have 15 aye votes.
Thank you. The motion to the reconsider is granted. Senator Castro,
With that,
on your amendment.
right, I'd like to withdraw my amendment, Mr. Chairman. Thank you.
All right. Are there any need for discussion? I just want to make sure that nobody's debating this. Do a roll call and make sure that everybody's in agreement that it's been withdrawn. Joe?
Thank you, Mr. Chair. On the motion to withdraw, Chairman St. Augustine?
Aye.
Chairman St. Augustine, aye. Vice Chair Rigel?
Aye.
Vice Chair Rigel, aye. Vice Chair Shelton?
Again.
Vice Chair Shelton, aye. Speaker Munya Barnes?
Again.
Speaker Munya Barnes, aye. Senator Lee?
Again.
Senator Lee, aye. Senator Therese Talahi?
Again.
Senator Therese Talahi, aye. Senator Peter Talahi?
Aye.
Senator Peter Talahi, aye. Senator Marsh Titano?
Again.
Senator Marsh Titano, aye. Senator Castro?
Again.
Senator Castro, aye. Senator Moylin?
Aye.
Senator Moylin, aye. Senator Munya?
Again.
Senator Munya, aye. Vice Speaker Nelson?
Hungan.
Vice Speaker Nelson, aye. Senator Perez.
Hungan.
Senator Perez, aye. Senator Torres.
Hungan.
Senator Torres, aye. Senator Taitagui.
Hungan.
Senator Taitagui, aye. Mr. Chair, you have 15 votes on the withdrawal.
All right, thank you. Thank you, my colleagues, that amendment has been withdrawn. We're back to the main amendment. I see on the chat, Senator Kelly Marsh, you have an amendment to this amendment, Senator?
Hungan, I've been thinking long and hard about this. Many of us have talked about concerns. Next year we may need, everything we're going through tells us we need as much flexibility as possible, and public health is definitely a priority. But we hear from parents and teachers and students, like we know that there are other priorities. So I've done my best. I've really tried to weigh it out, to weigh out the need for flexibility, the need to prioritize public health, and give us that flexibility to consider whatever may come our way, as well as the varying amounts per quarter. So I should be sending an amendment. It should be hopefully in receipt by your office already. And what it does really is it just says that let's earmark some of that money for sure. Let's earmark 30% and still leave ourselves the 70% of flexibility for other priorities, or if the following quarter has a real low or a real high, at least we've done what we can to put some towards the public health as a priority, but we've given ourselves the flexibility to also handle whatever else may come our way. So basically, there are just two things. In the first line, it takes out all, it crosses it out, and it says up to 30%, so that each quarter it's up to 30%. And then in front of the 6 million, it also just reiterates that we're looking at up to 30% of the excess funds, or $6 million, whichever is less.
Okay, Senator Kelly, we have not received your amendment. We're still waiting for it.
Okay, I do have a copy of it. I think I can just throw it on the chat myself.
Yes,
Let
please
me
do.
see.
The sooner you put it on, the sooner we can entertain it.
Well, yes, I was trying to go through proper protocol, but I can toss it on.
All right. Okay, stand by then, Senator Kelly. Madam Speaker, you wanted to say
I just
something?
wanted to make sure that we're right. Is Senator Marsh Teichner's amendment going to be to Senator Teresa's amendment?
I think that's all I understand it. Yes.
Okay.
It's an amendment to the amendment.
Yes, thank you.
Okay, so
There you go.
I think it should be there. Does everybody see it?
We should be seeing it any second now.
Yes, we see it.
Okay, if you can, Senator Kelly, if you can read it out straight through as you amended it, okay? You need to turn on your mic, please.
Yes. So let me read that amendment for everyone. So this is, do you want me to read from line 7? Line 7, page 7. To amend
Yes,
Senator.
yes, you read the whole amendment, ma'am. Nothing missing, so that everybody understands exactly what you read, what your amendment is.
Line 7, page 7, to amend Senator Therese M. Terlahi's amendment to the bill that adds a new section, a new D to section 5 of chapter 1 to read, D, notwithstanding any other provision of law, scratching out all, up to 30% of fiscal year 2021 withholding and corporate income tax revenues collected per quarter in excess of the revenue level adopted, or in parentheses, revenue budgeted in parentheses, for that quarter for both categories combined pursuant to 1A of section 2 of chapter 1 of this act as reflected on the monthly CRER are hereby appropriated to the Department of Public Health and Social Services for expansion of its environmental health inspections, its other regulatory purposes, and other DPHSS operations. The total appropriated amount of revenues collected in excess of the revenue level adopted for the entire fiscal 2021 pursuant to this subsection shall not exceed 30% of the total excess revenues collected, or $6 million, whichever is less. This appropriation shall not be subject to any transfer authority of the Governor of Guam. The Director of DPHSS shall submit a report to the Speaker of Y Legislatura en Guahan regarding the expenditures of the appropriations contained herein no later than 30 days after the end of each quarter. And I do want to point out that I did work with legal on developing the language for this to make sure that it followed the author's intent and our intent. And so they did guide the writing of this amendment to the amendment.
All right, we will begin with starting from the top for any comments. We start with my Vice Chair, Senator Clint Rigel. Sir, do you have any comments to make on this amendment, to the amendment? Nothing at this time. Senator Amanda Shelton, do you have any comment?
Thank you, Mr. Chair. Thank you very much to the author of the amendment to the amendment. I am a little bit concerned here about the percentage, the 30% that's going to be going to public health, but I understand that it's, it'll still be up to the $6 million here at the bottom of the amendment. So if I'm understanding that correctly, Senator Marsh?
Well, it does say whichever is less, And my point here being, I absolutely understand the priority, but I really am concerned about each quarter maybe having huge fluctuations or us just needing flexibility next year. It just seems to me that next year should be titled with a capital F for flexibility because it's got so many unknowns. So like I said, I'm just trying to find the balance. We hope to reach up to 6 million. That's definitely the goal, and we can always meet if we find that we're in a position that we can adjust it ourselves. But the 70% did seem important. So it still would be less. So let's say it was 1 million a quarter that they were able to garner. That would be great, but it would add up to 4 million and it would stop there unless we stepped in and intervened.
Okay, thank you very much. Obviously, it's a very optimistic amendment, right? To think that that 30% would be up to $6 million for the Department of Public Health and Social Services. And I think that looking at them as the biggest priority right now, I know all of us have gone around the room talking about public health and education also being a huge priority. I don't know if we'd like to see this 30% up a little bit more? Can you just give a little bit of reasoning to why you put it at 30% and why we're not listing the other priorities here? Because I mean, of course, I would be more comfortable to say the Department of Public Health and Social Services would get 70% and to see the rest go to education and safety. But maybe you can give us the reasoning and how you worked this out with the legal counsel.
Yes, well, as I was saying, you know, we really don't know, and we've seen some high ups and downs from month to month here in this year alone, in the last 6 months alone. And so, as I was mentioning, I think really priority, yes, but flexibility perhaps being the most important thing. But to make sure that while we're saying we absolutely need flexibility, let's make sure that we can guarantee at least something is absolutely going to public health. If we start locking it all in, because of course we all 15 of us care about education as a priority and our public safety as a priority and some other things, if we lock it all in, then we've lost our flexibility. Maybe the first quarter, as we saw this year, maybe the first quarter is great and we use up all that money, but look at how it saved us for where we are now. That 19 million, if I'm remembering the number correctly, that 19 million in the first quarter really helped level out some of what we're experiencing now. So I just don't want to do away with the flexibility, but I absolutely want to do what I can to make sure that we're supporting public health. Just absolutely.
Thank you very much, Senator Kelly. I understand and I appreciate where you are coming from. And I think that, you know, even at the $6 million mark, we heard from the chairperson of health that this $6 million is still not enough for them at the end of the day. So I will reserve my time, Mr. Chair, and listen to the discussion.
All right, thank you. Madam Speaker, Speaker Gina Muñoz, Senator.
Thank you, Mr. Chair. And I too share some of the same sentiments from the retiring speaker and appreciate the author of the amendments thought process on that. And I too want to listen. I believe just based on what was presented to us last Friday, and I want to thank the Senator on Health, Senator Terlahi, for putting that, is we understand that we are in this pandemic and we need all the resources we can get and to public health. And so I want to hear what else our colleagues have to say.
All right, Madam Vice Speaker, Senator Nelson, ma'am.
Mr. Chair, I'm not entirely supportive of this amendment to the amendment. I think that it will take away the intent, but we're already having conflicting, not conflicting, we're already having concerns about how we're going to realize the $6 million. We didn't, you know, in the front end, increase the withholding tax and where this money is going to come from and how it is spent. And now we're talking about a 30%, you know, appropriation. And so I'm not convinced that this amendment is really needed, but I'm still open to hearing the closing arguments of the proffer the amendment, and then I will.
All right, thank you, Madam Vice. Senator Lee, ma'am.
Thank you, Mr. Chair. I appreciate this amendment, and I thank the proffer for attempting to come up with something for us to discuss. But I still have a lot of reservations with the fact that this amendment still contains that quarterly appropriation of these revenues, and it's just really difficult for me to wrap my mind around this conservative kind of $6 million figure. Even just, I understand we're looking at 30% now, but I will just register. You know, in general, I'm supportive of the idea of this amendment, but Mr. Chair, we are, you know, we only have a few more days left to consider this budget, and I just really feel like we need to get going on the rest of the bill. So I'll just leave it at that.
Yes, all right, thank you. Senator Peter Terlai. Joe?
Joe, let me just listen to the rest of the comments because I don't see anything, I don't know why 30, I don't know what is so magical about 30%. If we go less than what we expected on that or to meet the 6 million, I don't know. I need to listen further, Joe. Thank you.
All right, thank you. Senator Therese Terlai, ma'am?
Thank you, Mr. Chair. And it's tough, you know, we're cutting drastically across many agencies here. My issue with the amendment would be that 30% is just simply 30% of what we're hoping might be 6 million or 7 million is 2 million or at the most, right? And that probably won't come again till the end. But 2 million is not enough. It's in order to get 6 million, we'd need $20 million in revenue above what we are projecting today. And so I don't think that's likely, or, you know, at least based on what we've been told. So I'm just objecting to the amendment because 30% is too small for public health. And I agree that we need flexibility with the government, that, and I've tried to, you know, craft the original amendment so that it gives flexibility, but if there are excess revenues, public health needs more than 6 million, and I'm capping it at 6 because I feel like if there's more than that, then the legislature has a prerogative to do what it wants with the rest. But I want to lock that 6 million up before it gets spent on anything else. And I think 30%, especially on a quarterly basis, is really not going to let public health be effective where we are counting on it to be effective. Just on its regular health, you know, communicable disease prevention, all of its mandates. So I don't think that our flexibility for the government should be on public health's back at this time. You know, we've not, you know, like was proposed in the last term, what was the bill? It was to reorganize the entire government, you know, so that we could fund these priority agencies up to what they need. We were able, I thought OFB was able to do, you know, to allow agencies across the board to try to survive, right? And we're taking a gamble. I just think, let's all admit, this budget is a big gamble. We're praying that we get these revenues. We are very much hopeful that we're going to get even these revenues that we're predicting. And I'm just hopeful that if we get more than this, please, let's just put it, at least 6 million of it, let's put it to public health. Let's try to get it to them with the original language as fast as possible, and not drag it out any longer. Even a quarter, I debated doing it monthly, but I put quarterly so that it would balance out any negative months. And that's it. Thank you. Thank you, Mr. Chair.
All right, Senator Sabina Perez.
Thank you, Mr. Chair. I'm weighing out the information. I do appreciate the efforts of Senator Marsh-Titano in regards to including more flexibility. So I do appreciate that, but I also see the drastic cut with Department of Public Health, and at this time, you know, they definitely need the resources. So I'm still weighing out my decision. Thank you.
All right, Senator Talatadwi, ma'am.
CJ's Masi, Mr. Chair. I too like to thank the author of this amendment, you know, for trying to find a way, you know, to fiscally be responsible and not to you all at one time. I mean, we may not even know if there's any excess revenue in the first quarter, let alone the second quarter. We don't know that, you know. So I have an agency, whether they give me $100,000 or whether they give me, you know, $10, I'll take it. It's not because it's not enough. Any amount that any agency can get, they should be able to get. I'm not sure why the 30%, why not 50%, you know, but I think this is, you know, a responsible number, 30%. And if my colleagues look at section C of, I'm sorry, section 5 and letter C, look at that section, notwithstanding any provisions, all funds in excess adopted revenue levels enumerated, and this is the highway fund of this chapter, are hereby appropriated to the Department of Public Works for flood mitigation members and improvements of road, highways, and streets. We're already doing that in letter C. So what's the difference from this into public health? Nobody's complaining about letter C here. So I think that, you know, I mean, this is a way to compromise, because at the end of the year, we're not going to have this opportunity at the end of the year, as we've seen in FY19. We don't have any say. This, at least here, we can appropriate to that particular agency. And I do support this amendment. Regardless if it's $1 million, $100, whatever there's funds available, then we should give it to Department of Public Health and Social Services. Thank you, Mr. Chair.
All right, thank you. Senator Torres, ma'am.
Thank you. My initial thought when I read this amendment is that in order to arrive at up to 6 million, you will need to collect 20 million in excess revenues. And I believe Senator Terlahi brought that point up as well. So you're talking about 20 million in excess to just arrive at 6 million, which is 30% of 20 million. But, you know, Steve, I just want to ask you a very pointed question, yes or no. Steve Guerrero, do you believe that we're going to collect excess revenues in fiscal year 2021 over and above what your projections are?
Senator, if you're talking about the entire year for both these two categories, I would probably say no, not that we're going to exceed the levels that, I mean, we could exceed it, but definitely not by 20 million. Now, if the 20 million is a combination of both withholding and corporate, then they might be a very, very slim chance that may occur. I won't say it can't. It just depends how the economy grows and it comes back. But at the trend that we're taking now and what we're projecting, that would be highly unlikely. But I will not say no, but it'd be highly unlikely that would materialize. Now, again, remember the amendment is not for the year; it's by quarter. So whatever we generate in excess of the quarter, that amount of money would be available for transfer. What we're talking about, the 6 million, is I believe the annual end of the year, and should we trend 20 million by the end of the year, then there is a possibility that $6 million can be transferred. But I believe the amendment is stating only quarter. And unlike, I believe the previous speaker that mentioned about the highway fund, if you look at the provision that she cited in the highway fund, that's per annum. That's you realize that at the end of the year. Unlike this particular amendment, it's at the end of the quarter. So that's the big difference.
Thank you, Steve. I think, you know, just going back to my original point too, unless we can be sure that we're going to collect it, then, you know, adopt a higher number like some previous amendment tried to do in revenues. Otherwise, you know, I believe that we just keep going around the same thing, but nobody agrees that we are going to adopt a higher number because we don't believe there's going to be more revenues. So, you know, my position is just that if we're going to be conservative and realistic, then let's decide on that. And whatever is excess at the end of the fiscal year, of course, it's our prerogative to appropriate it, where we deem necessary. But with that, I just, wouldn't support this amendment only because we decided to be reasonable about what our expectations are, and I don't think anything has really changed about that position. So thank you, Stephen. Thank you, Mr. Chair.
Thank you. Senator Moylin?
Thank you, Mr. Chair. Just for clarification, are we talking about Senator Marsh's amendment to the amendment, or are we talking about the original?
That's correct.
Oh, okay. I have no comments
Senator
on,
Marsh.
on Senator Marsh's. Thank you, Mr.
All
Chair.
right. All right, Senator Castro. No comment. Senator Munoz.
Thank you, Mr. Chair. I just take caution in making any comments on an amendment to an amendment when I haven't had a chance to speak on the main amendment in the first place. So I will reserve my comments until we get there. Thank you.
Okay, you reserve. Does any other of my colleagues would like to speak to the amendment to the amendment? On the amendment to the amendment. Several of you have held back. There being none, I don't see any hands waved, so we will move to vote on this amendment.
May I close on it as others have done?
Sure you can.
Great, because certain things were brought up, and so I'd like to address them.
Feel free.
As much as I wrote down notes for them, is what I'm trying to do here is find a middle ground. It seemed like there is a real hard line between those that are, and it's understandable on both sides, those that are looking for what is fiscally responsible policy and it being not supporting the main amendment, and those that see the importance of let's make a difference while we can for public health and being on that side. So I'm trying to find a point where we can get past some of the hard lines on both sides and say, let's have this as a starting point. Let's absolutely make sure that we have something going towards public health on a regular basis. At the end of the year or later on, we can always come back to it and determine what additionally to do. But at least along the way, there's been potentially regular money being pumped into our priority area. I just really worry about this amendment not passing because of these hard lines. So like I said, I'm trying to find these middle grounds. I just really think that flexibility is key. So that 30%, I went with 25%, I looked at 50%, but because we talk about the top three, education, public safety, and public health, I kind of broke it up that way so that we have the majority of this to address any crisis that comes up for public education. We can address any crisis that might come up for public safety. And really, if we're talking about fiscally responsible policy for all of next year, which we're deciding right now, more flexibility than less is important. As I mentioned as an illustration, those 19 million extra dollars, that surplus, if you will, or going beyond our expectations in the first quarter, is the only reason we have survived in the way that we have in the second and third quarters. And I just can't underline that or underscore that enough, I think. So I would just ask people to consider to have as much fiscal responsibility and flexibility as possible, with that nod to needing to give some extra money to public health. So Dios Masi, Mr. Chair.
Thank you, Senator Kelly. That was closing. Joe, let's do the roll call. Let's do the vote. The amendment to the amendment.
Thank you, Mr. Chair. On Senator Marsh Titano's amendment to the amendment, Chairman San Augustine?
No.
Chairman San Augustine, nay. Vice Chairman Rigel?
Aye.
Vice Chairman Rigel, aye. Vice Chairman Shelton.
Ahi.
Vice Chairman Shelton, nay. Speaker Munya Barnes.
Hungan.
Speaker Munya Barnes, aye. Senator Lee.
Hungan.
Senator Lee, aye. Senator Therese Talahi.
Ahi.
Senator Therese Talahi, aye. I am sorry, nay. Senator Peter Talahi.
Aye.
Senator Peter Talahi, nay. Senator Marsh Taitano.
Again.
Senator Marsh Taitano, aye. Senator Castro.
Ahi.
Senator Castro, nay. Senator Moylin.
Nay.
Senator Moylin, nay. Senator Munya.
Aye.
Senator Munya, nay. Vice Speaker Nelson.
Again.
Vice Speaker Nelson, aye. Senator Perez.
Again.
Senator Perez, aye. Senator Mary Torres.
Ahi.
Senator Torres, nay. Senator Taitagui.
Again.
Senator Taitagui, aye. Mr. Chair, you have 7 ayes and 8 nays.
Okay, a motion fails. We'll go back now to the main amendment. And before we go further on that amendment, I'd like to ask Steve to please explain and to tell us about Department of Public Health and what happened throughout this year in reference to the CARES funding and any future funding that does exist. So we have a clear, our colleagues will have a clear understanding of what the Office of Finance Budget has an understanding of the Department of Public Health before we move any further. Steve?
Yes, Chairman. Again, going back to how we derived at the ceiling for public health, it was basically, we used the percentage allocation that was allocated to the agency in 2020 and applied that to the allocation that we had for them in 2021. From there, we took into considerations other programs that we needed to basically revisit simply because the allocation was insufficient, only because, again, the percentage that we used was probably a little bit too high for the agency. We went ahead and made the adjustments. If you look at the spreadsheet, we made some adjustments in operation, but we also increased it in MIP. We also increased it in Medicaid. So there was an offsetting effect there. But we also, took into consideration some of the monies, the federal monies that the public health has. And I don't know if you recall, there was a spreadsheet that was provided to all the senators, I believe, in the second or third day of session when we were down at the legislature 2 weeks ago. And it indicated basically a distribution of all CARES and COVID-19 monies that Guam received in the amount of $1.6 billion, a little bit plus or minus. Of that amount in that schedule, public health basically was listed to receive funding for 23 programs, to the tune of $19.9 million. Those monies are available beginning March of 2020, and the latest one would expire in September of 2023. So you have staggered terms for each one of these programs. Most of these programs, I noticed that the expiration date is by September 20th of 2021. So there are a couple of programs that go beyond 2021 up to about 2023, but these monies are available to public health. If you look at the listing, there's specifically for various programs, but aside from the restriction of the use of these monies, I'm not too sure how restrictive they are in terms of utilizing the money for the operation of public health. So, with that being said, I mean, as far as, the funding for public health, granted, like Senator Terlai said, they are short. I mean, they could use a little bit more funds to help them in their operation. But as we go across the departments later on, you'll find there are departments that are short, but at least for what we feel is sufficient to cover the mandated ones, again, like personnel, contractual, your fixed costs, I think we were able to do that. Maybe not to the level that they would feel that is adequate, but I think it's the level at least to keep their operation going at minimal cost.
Which basically, Steve, you're stating that based on the federal funds that are available up to the 23rd, we're looking at $19 million. And if you spread that across, could you pretty much give us a general breakdown how that's being supported? How's that, correction, how is that supporting public health in the issue of, as the amendment was reading, for their operation, for contact tracing, everything to do with the COVID? Because I just wanted to make sure that all my colleagues understand that there are many other agencies that have short funding. There's a few agencies out there that intersect with public health. The Guam Police Department, the Guam Fire Department, the Department of Education, they all work together with public health. And I'm in support of public health getting whatever they can, but I just wanted to make sure that we have an understanding of when you identify the funding, what else could you identify across the board that would say that there's some balance in federal funding that everybody is able to get so that we don't have to earmark and project something that we don't even know if it's even gonna come. It's not like what happened in 2020 where the money looked good in the beginning of the first quarter and in the beginning of the second quarter, and then it dropped because of COVID. Now we're in COVID, everything is dropping. So I just wanna get a warm and fuzzy feeling for everybody else to have a feeling of what's going on. Steve?
Yes, Chairman. Just bear in mind that this $19.9 million of CARE COVID money that's available to public health is to be utilized for various programs across the board. If you ask me in general terms, every single penny of this money is COVID related. Now, to the extent of how these monies are going to be expended by the program, that's really up to the program to decide within the guidelines that are set forth in each one of these programs. But it would be difficult. I mean, what I can say right now is that these monies can be used for public health operation, provided it is not monies to supplant or to augment anything that's already budgeted in the 2021 budget. I believe that is one of the golden rules, that you cannot use CARES money and COVID money for that. So if there are items in the program, in the budget, that have already been budgeted for, those types of items would not be allowed to be used or to be paid for with COVID monies going forward. But anything that's not part of the budget, that they can at least relate to COVID, then I believe it is available for them to use with whatever restriction and guidelines they must implement.
All right, thank you, Steve. There are several of my colleagues here that haven't spoken in reference to the amendment, but I'll begin from the very beginning. Madam Speaker, you wanted to speak, ma'am?
On the Tulahi amendment, and I just want to say that though I support the initiative, and hearing the conversation also from the Office of OFB, I just believe and I think that public health is in desperate need of cash. And I think that we should look or strive into finding real cash and not hope that there's a pot of rain, a pot at the end of the rainbow. And Mr. Chair, this is not an easy one. But I do know that based on what public health has shared with us, based on the presentation, this is not easy. Where do we get cash? Public health has said they are in desperate need of cash.
Understood, Madam Speaker. We'll begin with my Vice Chair, Senator Clint. Do you want to make any comments?
Yes.
Or restate?
Yeah, thank you, Mr. Chair. I did have one question for Steve. So perhaps you could weigh in on what would happen if, say, the first quarter is above. So like say they collect $1 million over in the first quarter, but the second quarter is 2 million below. Does public health then give money back?
Senator, that's a very good question, and which we've been pondering for, I guess, the last couple of weeks with the whole entire body. Bear in mind that Government of Guam, when it collects revenues, it collects it on a monthly basis, but it also collects monies on a very staggered and uneven, unpredictable trend. So the first month, second month, third month could show good showings, good collections, just like it did this fiscal year. And then for reasons unknown, reasons beyond our control, that thing can be gone in a flash. I believe what really saved the Government of Guam this fiscal year is the surplus of $30 million by the end of July, which helped us carry through the end of the fiscal year. Although we are anticipating to end in the shortfall, but I would bet that I would bet that if we were to have not generate all that surplus money in the first 4 months of the year, I would hate to think where we would be at today. So in a nutshell, my approach is that although we may do very well in the first quarter, there's nothing to say that come the second quarter, things may not turn for the worse, or could continue on and collect at a fairly prosperous rate. But if the amendment is to authorize the transfer of excess money at the end of each quarter, then there is that possibility that should the second quarter roll around and we don't stay on track, then that may jeopardize the entire appropriation of the government for 2021 going forward.
Okay, thank you, Mr. Chair.
Senator Amanda Shelton, please. My other vice.
Thank you, Mr. Chair. I am working on an amendment right now, so if you can just skip over me and I'll be back.
All right. Senator, Madam Vice Speaker, I know that you're having an instability of your internet, but if you can still speak, even if it's just by phone, we would appreciate it, ma'am. Madam Vice Speaker.
No comment at this time, Mr. Chair.
All right, thank you. Senator Lee.
Thank you, Mr. Chair. I just have a question for the proffer of this amendment, if she'll yield.
Senator Reese.
She's supposed to state the question first, Mr. Chair.
All right. Okay, Senator Lee.
Thank you, Mr. Chair. So I'm just trying to understand why we would go this route instead of increasing our revenue. Is it because there's doubt in our minds that the 6 million will come in, or is it because this kind of conditional appropriation is better for some reason? I'm just trying to figure out why we're putting this type of policy, fiscal policy, before the legislature, and why we're choosing to go this route.
Senator Reese, do you yield to that question?
Sure, Mr. Chair. As I've stated before, you know, the whole budget is a gamble. We're receiving our best advice from BBMR and OFB as to what our revenues might be, but I think we've all made the point that they're very unpredictable at this point. And the other thing I think that we recognize across the board is that there's huge cuts. $66 billion are being cut across the government, and public health is also getting a cut. And I think, of course, the best thing to do is to give them, cut some other agencies and give public health more, you know, but that wasn't done. And so I'm trying to compromise here by saying, then instead of, you know, cutting anyone else, give them whatever's excess. And BBMR is really trying to convince us that there will be excess. And so I feel like if public health ends up short, the governor's going to carry the brunt of that. They're going to have to use their transfer authority. And if we get excess revenues, then we as a legislature should demand that this is where it's going to go. It's getting ahead of them using it for anything else. And really, that's the policy that I'm trying to put in front of you. And of course, if you can find cash someplace else, then that's better. They need 13 million, 14 million according to BBMR. But you know, I'm not willing to cut the hospital or education anymore. And I thought that OFB really had cut dramatically for these agencies. And I hesitate to cut them anymore because they've been very severely cut already.
And I apologize, Mr. Chair, if this question has already been asked and answered, but where did we come up with this $6 million figure? Was there a calculation that was done? Are we basing it on, you know, collections or anticipated revenues? I'm unclear about this $6 million figure now that we're considering.
Okay, thanks. I started off with it's about the overall budget for public health versus FY20 is short by $3.5 million. Now I went into detail earlier that doesn't really equate to what they're being short in operations, because additional money was given to public health by OFB, which I'm very grateful for Medicaid and CHIP to match, right? So we can get more federal funds in Medicaid and CHIP. However, even that's not enough for what we could get in Medicaid and CHIP. But the 3.5 is because 3 million is for that shortfall this is to fund current public health programs. Nothing necessarily related to CARES except to let them continue to operate with their current, you know, program. So we don't neglect the diabetes program while we're trying to take care of the CARES. And they talked earlier about the CARES money, and I agree, they are going to get some CARES money or COVID related funding. And some of these include things like the additional grants for child care. There's a, wait, let me just get it for you. I have a list. You know, epidemiology, COVID response, even additional programs for the aging. They were good. You guys know Linda, she got a lot of these, they applied, they were aggressive and applied for a lot of federal grants to expand their programs because of COVID. But they can't necessarily use those to cover their existing programs. When they applied, they had to, you know, say, this is what we are doing currently and we need to expand these things because of COVID. So I'm trying to just get them to the level that they are able to continue with their existing programs, and everything above that is because of the additional duties that the COVID has placed on them, which are tremendous. For example, additional funds went to them for you know, SNAP grants, and but that's all because of the additional need. So it's kind of, you know, we can't balance, that's what I'm saying, the shortfall of the government on their backs, because that's going to have negative impacts on the community. Did I answer your question? I'm sorry.
No, but
what was your question again? If you could just restate that. Maybe I got confused. What was it? Just to
my question was the $6 million proposal in this amendment. How did you come up with the $6 million? I understand that DPHSS is short, GDOE is short. There's so many other different agencies that are short, but unless we have real revenues that are going to come in, that we, you know, in amendments that were considered previously, I just don't understand how the previous amendments of 4.6 million were not conservative enough, but we're coming up now with a $6 million amendment that is still conservative in the eyes of some of our members. And I just don't understand how we arrived at that figure. And so I'm just trying to understand the amendment a little bit better.
All right, yeah. So the amendment, I mean, like I said, they need much more than that. I came up with 6 because of the promises by BBMR that if we're going to see more, we might see 7 million more. But I also came up with 6 because of the 3 million that they were short from FY20 for operations alone. I'm sorry, overall, not just operations, because it's 13 million short in operations, and also because of the 3 million that they estimated that they needed to expand their environmental health division for inspections, and other programs were also combined in that estimate that they had given for supplemental requests for CARES money. But yeah, so that's why, because we want them to expand their environmental health, and those were the estimates that I received. Trust me, public health wants 13 million more in their budget for operations. So I'm trying to, be rational on how I come about this. If excess revenues exceed 6 million on a quarterly basis, I'm going to be the first one to come in here next quarter or in January and say, if I get in and say, let's re-examine this budget and put more money towards public health. I really think they need, so thank you.
Understood. Thank you. Thank you, Senator. And Mr. Chair, I have a question for OFB. Steve, you worked at BBMR for years and years. How would BBMR actually load this excess revenue appropriation in the AS 400 system? Does BBMR recognize this type of amendment?
Senator, if you're referring to the collection, I believe what happens is that when revenue tax submits that information to DOA, DOA loads it as per the revenue category these monies are received.
Right.
Now, to tell you the truth, I honestly, in my years of working there, we do not recognize excess money until the end of the fiscal year, for the mere fact that at any day, any month, any quarter, things can change. And so example was this year. So we were collecting 12 million in October, 15 million in November, 29 million in December, 30.2 million in January. February drops down to 17 million. March was a -8. April was a -4. May was a -8. And in June, a -13. Well, that tells you how things can fluctuate in a matter of 1 month. So as far as recording it into the system, I know they recorded it as receipts, revenues being generated per the month, but in actual terms of any excess surplus over the appropriation, that is not determined until the end of the fiscal year.
Right, and I'm referring to the appropriation and not to the collection. So Steve, wouldn't it be more certain if we increase revenues and actually appropriated it to DPHSS? I'm just really concerned that we're pretending that we're solving something here and it's not actually gonna be realized. We're not actually gonna be giving DPHSS the resources that they need.
If it's revenues that we know for at least some sort of certainty will be generated and can be collected, then I would think the prudent approach would be to appropriate it.
Right.
Because
And
you're under the assumption that this is going to happen.
So I just wanted.
But if you're, go ahead.
So I'm just confirming, reading the amendment, the under the 2 general fund revenue categories, I guess, in the amendment were corporate and withholding. Do you think that $6 million will be collected in those categories in excess of what we've adopted?
As I believe I mentioned earlier, is that you know, the revenue projection that we came out of OAB was based on what we felt was something that's realistic, that's something that's achievable. Anything above that would be in the areas of being uncertain. And like I said many times, it's difficult to determine that right now, other than what we know and what we have already projected.
Right, what we've already collected too.
As part of the trend, yes, to establish the trend, yes. But
Thank
you know,
you
like I said, if it's something that, like, if there is, you know, some sort of reasonableness that you think this is going to materialize, then of course you would want to put it in the revenues and just not mess with it. But I think the amendment is siding on the side of caution, just to say, if we don't, then we're okay with the current levels that we have. If we do, then like the sponsor of the amendment is saying, she just wants to make sure that it's kind of like spoken for already, without any chance of it being utilized for any other purpose other than the intended purpose of the amendment.
Understood. And Mr. Chair, I just want to thank you. And as we've heard from the proffer of the amendment, this proposal is based on what DPHSS is short, but not necessarily based on actual revenues that have come in. And I totally agree, DPHSS is short in this budget, GDOE is being shorted, GVB is being shorted, but I also, will have to object to this amendment because I feel like there's some irony in an amendment to raise revenue by $4.6 million failed because we wanted to be conservative last week, but here's a plan to spend $6 million. So it doesn't add up to me. It defies logic, as was mentioned before, and so I object to this amendment.
Thank you, Senator Lee. Would anyone else like to speak on the amendment? All right, let's go first with Senator Muña. I believe you haven't spoken yet, correct?
Not on the main amendment, but thank you again for calling on me. Every time it gets to my part, there's an amendment that comes up to the amendment, and then I kind of get lost in my thought. But thank you for calling on me. Yeah, I have I guess part of my issues with this amendment is because my heart wants to give all the money to public health. I mean, we see and we hear it in their voices that they're underfunded and overworked. I mean, it's very obvious that they're the main agency that's taking care of this entire pandemic, of course, with an extension of public safety and education. But I know public health, if I had it my way, I mean, like the chair for health was mentioning, a lot of these programs are being underfunded, and it could also be because a lot of their staff is now being shifted in so many different ways to take care of what the pandemic is, in order to take care of the pandemic. And so really, I want to give public health all the money, as much money as they need. But again, like I said, it needs to be spread out. And I think that's really where I'm torn, because I do know that public safety needs help. I do know that education needs help. I think part of my concern is, I mean, if we give this excess revenues to Department of Public Health, I mean, how would we cover some of the other shortfalls if they have carryovers? If we do this on a quarterly basis, how are we going to be able to cover some of the other shortfalls in the following quarters beyond that? So that's really what my concern is. If we give them everything at that moment, will we have enough for the next time? Will we have enough for the next time for things that were already appropriated? That's where my issue is. And then I think also maybe the author of this amendment can answer a question. So what we allocated or what we budgeted for the match for Medicaid is way below where we are now. Couldn't it be that couldn't we use some of that to cover some of their operations, because history repeats itself every year for GMH and public health. They're always underfunded, always. So now, since we've only budgeted a certain amount for Medicaid, could we use some of that to cover some of Department of Public Health's shortfalls in the next fiscal year?
Public health is, like I said earlier, the current bill that we're looking at gives public health 71 million for Medicaid, but they need 127 million to get full funds, to get everything that Guam is entitled to. The current bill also gives for CHIP 21 million, but they would need 34 million in order to go after that full amount that Guam is able to get in these. And as you know, the need is greater, but so they anticipate the ability to use all of what Guam is entitled to, that we have that kind of demand, in other words. And so, of course, that was my first thought was, oh, we need to fund this with this extra, if any more money comes in, this is what we need to fund. But they're not even able to meet their current operations. That's the issue. And but the excess, if there is any excess Medicaid at the end of FY20, they want that to address the shortfall in Medicaid that is very clear to them for FY21. So yes, that's another provision in the bill to allow them to carry over any of that excess towards their Medicaid for FY21. Like I said, 71 out of 127 and 21 out of 34 for Medicaid and CHIP. So yes, they are kind of banking on that, if any excess from FY20 in those areas, to go towards those programs in FY21.
So even if we budgeted at 45% local match, and now it's been reduced to 17%, we still, even with that savings, we still wouldn't be able to cover their shortfalls for operations? No, because of the shortfall in Medicaid and CHIP for next year also. Yeah, and this is from Tess. We had a meeting regarding their budget, and that's her big concern. She was so concerned about that, and then we discovered the operations part. So they're hoping to get that carryover for the Medicaid and the CHIP to help them to get more of the Medicaid and CHIP that's available to Guam in FY21. Otherwise, I agree with you. That's a priority. Okay, I think it's a good idea to dive in a little bit more into the Medicaid state plan and just see, what's how it's operating. I think it would help us to understand, how we can still have a shortfall even though the Medicaid match has been reduced down to 17%. So be a good idea to look into that. Also, I think that maybe this whole discussion would be very beneficial if we discussed it in the public health portion of the budget. That way, when we get to that opportunity, we can get public health on here to ask them all these questions. But at this point, thank you, Mr. Chair. I think so. Those were some of my questions. I was just wondering if maybe we could utilize some of that savings for Medicaid to cover these shortfalls for public health.
All right, looking at the list, kind of skipped a little bit. We got Senator Muniz, that was a good one. Senator Kelly, ma'am. Yes, you on the list. Senator Kelly, you have any comment, ma'am?
Ms. Maasi, Mr. Chair, and I appreciate the good discussion and the good questions that have come before us. Feels like they've really set out some strong findings and information. If I could ask the OFB director a couple of questions. When we're talking about the, yes, Ms. Maasi. When we're talking about the corporate and withholding those tax revenues, what percentage of the overall government revenues are we talking about? If you could refresh my memory.
Yes, Senator. Just taking this the proposed FY21 revenue base, if you took the 630 million that's available for appropriation, corporate constitutes about 13.6% of that total. Withholding constitutes about 36.6% of that total, for a grand total of 42.2% of the entire appropriation available for appropriation.
Okay, so, I mean, not counting federal grants and so forth.
No.
It's really about almost, I mean, it's rounding off too much to say 50%, but you know, it's a significant amount. So when we're talking about this, we're talking about almost half, understanding it's not half, but like almost half of the actual cash coming in. And if you can either quantitatively, like in numbers on a scale of 1 to 10 or something, or in a qualitative way, in explaining it, you know, as you went through each month and you talked about the positives that were in December of last year and November of last year and January of this year, and then it was really quite sobering to hear about the lows. -13 really hit me hard. And just seeing that great disparity. So in the need for flexibility for next year, I mean, I've said I think it needs to be something we have with the capital F. You know, give me every agency, I care about them all, and I certainly care about public health and education, public safety, like, I think without a question of a doubt for all of us, they're just priorities, but on a scale of 1 to 10 or in a qualitative way, how would you describe our need for flexibility for next year?
Well, given the limited resources already available to operate the government of Guam, and the bleak outlook of what you know, our economy may go through next year, considering if things do not change for the better within the next several months, I think flexibility is important, simply because it provides a tool to make sure that you can cover areas of shortfall that may have either been predicted or unpredicted when we put this budget together. Now, you know, of course, one of the caveats on that was that, unlike in this fiscal year in 2020, we gave the governor 15% transfer flexibility. Next year, we're proposing a 30% transfer flexibility, but also at a lesser appropriation level. So, you know, we're reducing the general fund by 29 million, the special fund, I believe, by 36. So given those parameters, you know, increasing the transfer flexibility may not even be so much of a, I mean, people may say, well, 30% is a lot. But if you really think about it, 30% of a restricted amount is really kind of, you know, just a tool available to make things happen, and at least to cover those shortfalls that we did not anticipate 6, 8, 12 months earlier.
So to Asmasi for that answer, you know, a couple of things that you said really resonated with me. When we conduct research, it looks orderly in the end, but as much as we plan it out, it's all kinds of the unknown, the unprecedented, the unforeseen, the unpredictable, and then you put it all back together in research and you lay it out in an orderly fashion, and people don't really understand the journey that you were on to get to the end. And so, you know, I have faith in this body. I have faith that we will get together, and when crises are there, well, the 36th, that when crises come our way, we will meet in emergency session. We will do what's needed. We will, but just to lock away a tool of flexibility, it doesn't take away from us giving to public health. That tool is still there, but it doesn't take it from anything unforeseen, unprecedented, unpredictable, or as one of the former speakers was saying, and I've mentioned as well, you know, GDOE is looking to make sure that they don't lose their federal grants because of shortfalls. So yeah, it's tough all the way around, but I appreciate you providing that explanation about the importance of flexibility, the fact that we're talking about 42% of our general fund revenue stream, our actual cash that comes in. It helps give us the information we need to weigh this out. Mr. Chair.
Thank you, Senator Kelly. Senator Amanda, you mentioned you will be proffering an amendment before we go further, so we can close the loop here. I hate to go to vote and you're going to have an amendment. Senator Amanda?
Yeah. Thanks so much, Mr. Chair. My amendment is in the drive under my name. Colleagues, if you can see it. It's a really simple amendment. Earlier, we had an amendment that tried to address the other priorities of the government of Guam. And so realizing that we all really want to prioritize the Department of Public Health and Social Services, especially during this public health crisis, I like to offer this amendment that anything beyond the $6 million, if $6 million is even collected in excess revenues, that anything beyond that amount will go toward education. And as we've seen, education has also seen a cut, as all agencies have across the board. And I'd like to see us to take a stance to prioritize those agencies as well. So, Mr. Chair, the amendment reads, in the original amendment, the total appropriated amount of revenues collected in excess of the revenue level adopted for the entire fiscal year 2021 pursuant to this subsection shall not exceed $6 million, and then to add a new line that says, all revenues collected beyond $6 million shall be appropriated in equal amounts to Guam Department of Education Operations Fund, the Guam Academy Charter School Fund, University of Guam Scholarships and Training Programs, and Guam Community College for operations in fiscal year 2021.
So your amendment is after the 6 million.
Yes, Mr. Chair, after the $6 million, so that anything that comes in beyond $6 million, of course, crossing our fingers that we see this this revenue, that it will go to equal parts to the different education agencies.
Okay, I just want to make sure we have an understanding, my colleagues. When we talk about the millions of dollars, it's throughout the year. So when you say 4 quarters in the year, the 6 million equates to 1.5 per quarter. Am I correct? Steve, if you can correct me, if I'm trying to do the math, there's 4 quarters, it's 6 million, you divide it in 4, it becomes 1.5. So it means every quarter, anything over if we get to the 1.5 or $2 or $3 million in the quarter,
6 million divided by
1.5 goes to public health. Everything else will go to the other folks. Am I correct, Senator Amanda and Steve? If the map is correct, stand by, Senator Kelly. Senator Shelton.
Sorry, are you asking me to respond? You're asking Steve to respond.
Well, I wanted Steve with the math, but if you could, I appreciate it.
Mr. Chair, my understanding of the amendment is that, or the original amendment is that we're requiring a report at those parts, not necessarily that we're going to wait for every quarter to appropriate that money. If more money comes in one quarter, then I'd hope it would go directly to DPHSS first.
Understood, but are you referring?
The author of the original amendment can clarify if my understanding is correct.
All right, Senator Therese, if you can clarify, are you saying on your amendment that every quarter, if there's anything up to 6 million, Department of Public Health will get all 6 million in the quarter? Am I correct?
That's correct, Mr. Chair. The goal is to get the money to public health as soon as possible. And I appreciate this amendment because anything above that would go to these other priority agencies.
Okay, wishful thinking, but okay. Why don't we go and we start from the beginning? I'm just doing the simple math. 6 million throughout the year, trying to help out public health. We need to help everybody else. DOE, UOG, GCC, charter schools, the police department, Guam Customs. There's a variety of agencies that are short across the board. Public health will get all the support they need, but you have no police officer go and check the contact tracing. So I'm just trying to be very careful. But we'll start from the very beginning. Your amendment has been proffered. Senator Clinton, do you have any comment, sir? No comment? Okay, moving along. Madam Speaker, do you have were you able to reload, Madam Speaker? Okay, we'll come back to her. I don't think she's still trying to reload. Madam Vice Speaker, or wait. Madam Vice Speaker.
I support this amendment, Mr. Chair, and I'd like to thank Senator Shelton for just kind of forward thinking. We know that GDOE was shorted $10 million plus, and we're concerned with the maintenance of effort. So anything that we see beyond that, we've seen it trending that in previous years there were excess amounts. And so hopefully with this language that we don't have to debate the rhetoric and that it can actually go to the agencies that we appropriate the excess revenue to.
All right, thank you. Senator Lee?
Thank you, Mr. Chair. I'm in support of this amendment, I guess, but since this is such a great idea and we're all really considering this, maybe we should just fund all of our shortfalls with excess revenue and then we'll be done with the budget.
Thank you, Senator Lee. Senator Kelly.
Sedus Maasi, Mr. Chair. So, yeah, you're talking to an educator here. I absolutely love education. Love my health. But the more that we lock this away, the more that we're taking away from a tool that we may absolutely need. But the bigger thing is, I think here is, the way that I'm reading it is the 6 million has to be realized first. Sorry, Mr. Chair, I found fault with your with your mathematics, but it wouldn't be. In the way that it's written, I don't see that it says every quarter 1.5 million goes to public health and any excess beyond that goes to GCC. And so the biggest issue I have here, in a sense, I guess maybe they're 50-50, is it wouldn't be realized until at the end of the year, after everything is calculated, until after the fourth quarter, and we'll be in the same boat we are here. What is it, August? And we're waiting for the excess fund report from last year. So UOG and GCC, I don't think would absolutely not get this until maybe August of the year after that. So I just don't think it even meets the good intentions. And of course, I love the intentions of all of this, but I don't think it meets the intentions in time and real money in real time in those times of real need. And, again, I just see that we need flexibility, and I just really, really am concerned about lack of flexibility to address anything that comes our way. I mean, not to take a turn left or anything, but I mean, we're here. And I'm not saying this for Guam per se, but I mean, we're talking about the bubonic plague and locusts, and you know, all kinds of things that are happening. We do not know what's going to happen next year. Not to, like I said, not to get into those areas really, let's just focus on our public health crisis now. So I just stick with, we need the tool of flexibility. We don't know what's coming our way. I understand and support both the intentions of the amendment to the amendment and the main amendment itself, but I'm just really, really wary of locking any tool away from us, given just the unknowns. So just Masi, Mr. Chair.
And thank you, Senator Kelly. And you're right. Yes, Century's clarified the 6 million. It's every quarter, $6 million. That's really what it comes down to, every quarter. So moving along, Senator Peter Chulai.
Thank you very much, Mr. Chair. You know, the thing is, you know, we're committing, you know, like going beyond the $6 million and any lapse over that. You know, we're committing those lapses to, you know, we're actually not definite on the, you know, on the money that's coming in yet, and we're recommending those amendments to, you know, we always need to give the governor some also, and Senator Marsh is right. We need that flexibility, because if we commit those two amendments on all the lapses that we're talking about, then what are we giving the governor in as far as her flexibility to assign those money over to other agencies? Why don't we just leave it like that and not really commit any amendments to any lapses that's over the funds? I don't know, all these amendments, and I believe that we have to have that flexibility, and I really concur with Senator Kelly about that. Let's not commit any other funding without knowing you know, the finalizing, you know, coming out with a true budget, with the true funding of each agency. I'm just kind of just really concerned about those things, that we're committing those extra money or whatever lapses we have, anything over the anticipated the funds that we need to give an agency. And we need that flexibility to give it to the governor and let the governor decide where that money is going to go afterwards. If there's any leftover money that any of the agencies need, let the governor decide and assign it to them. We're taking all this as an amendment, and we're dedicating it to you know, agencies, and I understand that, but the governor can do that later on. So you can always come up with that emergency you know, session to assign whatever is left within the government. We're talking about public health and all that, but also we need to think about public safety. We need to think about, you know, other agencies. So we need to kind of shy away with some of this amendment, committing this money or any lapses to a particular agency. Thank you.
All right, thank you. Senator Teresa Chulai. Senator, do you have any comments?
Thank you, Mr. Chair. So on the amendment that would provide that all revenues collected beyond 6 million go to DOE, Charter School Fund, UOG scholarships and training, and GCC for operations. This amendment also recognizes the shortfalls in these agencies. And I think even with these amendments, let's not delude ourselves that we're totally addressing the shortfalls that these agencies are going to operate under. And we're not anywhere addressing what the other agencies are going to operate under. We're just trying to prioritize. And yes, this is something not been done before, but we are adapting ourselves as a legislature. It's what I'm trying to do is to meet, you know, the challenges that we have in front of us. One of the challenges is if we do, I'm trying to support OFV's projections. That's first of all. And the other way to do it, I'm telling you, is to cut all the other agencies and put it towards public health. You know, but in order to go forward in a, you know, I thought reasonable, I'm just going to try for, if there is extra revenue, we're going to for the first time as a legislature, at least attempt to. And I've watched other legislatures try and try again to tie up money that comes into the government of Guam as supposed to be tied up for tax refunds. And we're still trying to enforce those types of laws. So this, we're going to still try, but I refuse to give up trying. I refuse to, you know, give up our authority to appropriate any excess money. And so, yes, we're appropriating something that might not come in at all, but I would rather do that and give public health some kind of hope to, you know, that we're going to not totally shortchange the people of Guam in all healthcare areas, and that we're going to give them some kind of hope. And if things are better, then let's make it better. And if they're worse, then by all means, the entire government is going to be suffering from shortfall if we don't meet our projections that we are allowing for in this bill. But with my amendment, what they plan for based on this budget is going to go forward. And we are only going to allow them to use what else might come in. And if we can come up with a better way to do it, I'm game for that, but I'm not going to give up as a legislature our authority to appropriate funds. And we've seen this, that you know, we need to fight for that. We need to ensure that we are going to have some kind of control. The governor has, in this bill, 30% transfer authority. Believe me, we are giving her more tools than any governor has ever had. 30% transfer authority. She still has compact impact funds. She has CARES funding in 117 million plus whatever else comes in. I mean, I don't think we need to worry about the governor's ability to function. It's these agencies that are charged, and we're putting it on their backs, and you can see this physically because we're seeing the same personnel at public health, you know, having to expand their services, you know, and we are urging them, trying to help them to get true expansion, like true, you know, additional personnel to get on their, you know, when they use their federal funds, like for the tracing, and they have a plan for those things. But I'm just saying, it's dire.
All right, thank you. To the people of Guam, we apologize. We had some technical difficulties. We're back on our committee hearing. Let me see, we left off with, I think Senator Therese. Yes, we're back with you.
Thank you, Mr. Chair. I hope I can remember. I was going off for probably 5 minutes when we got cut, but I'm going to just try to summarize. And yeah, what I was trying to say is I support the amendment, and that I don't see any harm in trying to appropriate the excess revenues. In fact, I see it to be a win-win, because if we get the revenues, then these very critical agencies are going to receive the money. If we don't get the revenues, then we're going to have to find another way. But if we are short, they're going to have to, the law already allows us, if we're short, to come back in and redo the entire budget. So I think it's just going to keep the legislature more active. And as I said, you know, what we're trying to do has not really been done before, or we tried it and they denied us use of the excess funds. So we're trying to redo that and say the cash that shows at the end of, you know, the quarterly CRERs. And I'm hoping that that will be effective, you know, in good faith. And we are trying by all of this to reclaim the legislature's authority to appropriate these excess funds. That is our job. It's our prerogative. It's supposed to be based on the input we receive from the public as to what the priorities of the government really are. And we have asked OFB to make these huge cuts, the $66 million, to meet our projected revenues. And I am trying my best to honor those cuts that have never been made before, Mr. Chair. But I'm also trying to, get what public health needs. And now that these other agencies by this amendment. And I don't think that this impedes the governor's tools that are available to her, because this budget in fact gives her a 30% transfer authority, which is double the current transfer authority and double the transfer authority that's allowed by law. She also has compact impact funds available to her for use in a variety of different areas without our input. She has $117 million in CARES fund that she never hesitates to remind us we cannot tell her how to use, $117 million. And so, I worry because they seem to have chosen not to give the excess funds of 10 million, just 10 million of the 32 million to the hospital, as we tried to do in the last budget. So I'm hoping that we can take care of DOE, charter schools, the UOGs, and GCC shortages with these funds and still, honor the projections made by OFB. Thank you, Mr. Chair. Thank you to the sponsor of the amendment.
All right. We have Senator Sabina Paris. Would you like to comment to that?
Yes, thank you, Mr. Chair. I think this is a good amendment. I think, in addition to that, we're dealing with a health crisis, we're also dealing with an economic crisis, and investing in our education is really the way forward to get us out of this. As we're dealing with about 40,000 unemployed and the unemployment rolls, how are we going to get them back to work? And, to get to that diversified economy that we want and need, investment in our education, our schools, our colleges is going to get us, is going to allow us to rebuild our economy. So I do support this amendment. Thank you. One more thing, I wanted to add a little bit more language to kind of emphasize that, the use of the funds in education to, use it towards the retraining of workers and towards this new economy. So I would like to send that over once I get it developed.
Okay, Senator Sabina, and it's almost going back to what Senator Lee says. Why don't we just identify everything to go to everybody, and whatever excess, we just send it to everyone else, so they public safety can also be taken care of. So I want to hear from my colleagues. Okay, Senator Tello-Taiwi, ma'am. Yes, Senator, hold on, Senator Taiwi, hold on, please. Senator Sabina, yes?
Yes, sorry, my apologies, Mr. Chair, but just one more thought about flexibility. And, I think that perhaps, a memorandum of agreements between agencies is one way to attain the flexibility. So for instance, if, there's more ways to gaining that flexibility. And I would like to encourage our agencies to do that, when we're assigning funds, appropriating funds. I think this is one way that we can approach appropriations that can create more flexibility. So I would like to highly encourage that effort.
All right, well, when we see your amendment, then we work from there. Going down the list, we have Senator Tello-Taiwi. I know I saw your hand waving, Senator Kelly, but hold on, we're going to go down the list. Senator Tello-Taiwi, ma'am.
Just Masi, Mr. Chair. I'd like to thank the author of this amendment to incorporate education. And very nice that you remember to incorporate Guam Academy Charter Schools. I greatly appreciate that. I'm one of the biggest fans of them. And I think it was said earlier about the governor having transfer authority of 30%. I mean, the current one is at 15, but even in 2019, it was 15. And I believe even 2018, it was 15% of transfer authority for the governor. That's quite a bit of transfer authority. If anything should be, any transfer needs to be done, that's quite a bit of money for her to have. But like it was said earlier, I submitted my amendment, all my amendments earlier in the game. So everybody has the opportunity to review all our amendments even before we get to the page that it's proffered for. And, you know, my amendment talks about excess revenue, and it talks about that all excess revenue adopted shall be for the appropriation shall not be appropriated without a legislative approval, and expenditures for such excess funds. You know, that is like a all around excess revenue coming in, and it is toward the end of the year. But the point is that we need to capture these funds sooner than later. And we don't want to have to come into a situation where we find out that, you know, oh, it needs an audit first, you know, to move forward. But I'm pretty sure in the 36th Guam legislature, who's ever there, if anything should arise, that that the funding that is not even there, or there is funding in one quarter, but less amount in the second quarter, that legislation will be created to adjust that. But the point is that we need to capture these revenues as we move along, sooner than later, which is so important, you know. And I totally support this amendment, especially with education. I greatly appreciate the author of this amendment thinking of them. Thank you, Mr. Chair.
Thank you. Thank you, Senator Tadwi. Senator Torres, ma'am. I'm trying to see. Oh, she's not on. Oh, there she is.
I don't have any comments, Mr. Chair. Thank you.
All right. Senator Moylin? Where you at, Jim?
I'm here.
There you are. All right. Any comments?
No comments, Mr. Chair. Thank you.
All right. Senator Castro?
No comments, Mr. Chair.
Senator Muña?
I have no comments, Mr. Chair.
All right. And I know I saw some hands waving earlier. Senator Kelly, you wanted a comment?
Well, it just seems that there are several interpretations floating around about, is it at the end of the quarter? Is it each quarter? Is it at the end of the year? So I was just thinking we would want or need some consensus as to when we're talking about. As I read it, and I appreciate the former speaker, I think she was saying that she reads it the same, that it's at the end of the year. So I just wanted us to make sure that we were all clear on that it's at the end of the year, just as a detail, so that we're all thinking of it in the same way.
All right. I'll have Senator Amanda explain that, and also Senator Therese, so that my understanding is every quarter, $6 million. If there's $6 million, it goes to Department of Public Health, and then after that, anything in excess of that, it ends at 6 million. As a matter of fact, if I'm correct, if Public Health, if they get the first 6 million in the first quarter, that's it. They don't get any more excess, and then everybody else gets. But I'm just not comfortable with. We don't know what the total amount will be after that. And I hate to, I just want my colleagues to understand, and the people want to understand. As I support education, I'm just concerned about the charter school. I don't want it to be sending a message that if there's any excess money, they're gonna up their student population or their student funding per student. It doesn't change anything. So how we support them is another equation we need to consider when we get to their chapter. When we talk about any excess funding as we move forward. It's easy for GCC, UG, and DOE, because their shortfall will be covered as we move along. But charter school is a different setup. They have student authorization and per student cost. The excess money doesn't give them the increase unless it's put there. And it doesn't give them the increase of students. But at the same token, I just like to reiterate that I'm worried about public safety also. Okay, so thank you. Senator Amanda and Senator Therese. Amanda first, and then Therese, you may comment in addition to what I've said. If maybe reinforce it or.
Thanks, Mr. Chair. I think I have the same understanding as Senator Marsh-Ty to know that it's the total for the whole year. If it's $6 million, and if it happens to come in one quarter, that's great. But if it's coming in gradually through the quarters, that's fine. And then at the end, when we reach $6 million, that's when any excess will go to education, to the Department of Education, to the charter school, to the University of Guam, and to the Guam Community College. So, I mean, fingers crossed we could see $6 million in one quarter. That would be excellent. But, being realistic, of course, the year. I'm frozen. Can you hear me?
I can still hear you, but we're coming in broken up.
Okay. Yeah, internet is unstable.
So just want to say, as long as we're on the same page, I mean, before we vote, whatever our stance is, we should just make sure we're all understanding it the same way. And I felt like I had heard it 3 different ways. So Sejus Maasi to the author of the amendment to the amendment.
Okay, Senator Therese, would you like to comment to that, add to that?
No, I agree with both of your interpretations. I think that's consistent.
All right, I'm just looking if there was any others I don't see in the chat. They're asking, Senator Kelly, you asked if we can get legal to say when the money will go to education. My readings that it's after the fiscal year.
Well, yeah, we already resolved it amongst ourselves, so.
Mr. Chair?
Yes, Senator Tello, yes.
I'm reading this amendment here, and all revenues collected beyond the $6 million shall be appropriated in equal amounts to Guam Department of Education, et cetera, down the line for operations fiscal year 2021. But if you read prior to that amendment that was made, it talks about it's collected per quarter. There's nothing in this amendment saying that anything at the end of the fiscal year of 2021, excess revenue shall go to them at the end of the year. The way I'm reading this, and the first paragraph of this full amendment as is, says per quarter. But I'm hearing from, good Senator from Nimitil and Asen that it's not that. They anticipate it at the end, but so if I may, Mr. Chair, we need to get legal interpretation on this, because the first paragraph sets the stage.
Correct. And I'm only concerned, Senator Tello, I think I'm in line with you, is that after they reach the 6 million, it talks about education. It doesn't have any limit. I'm worried about that because public safety plays a role here. There's other agencies that they're just barely, if you look, if everybody had looked at the budget, everybody got a cut. And that's why Senator Lee's comment was that we should just appropriate it, that any excess will just fund, maybe public health would be first, but then everybody, their shortfall should have a role here and a percentage be given to everybody. Okay, Senator Tello?
Yeah, and you're right, Mr. Chair. I think, if we're going to do that, we should add in public safety too as well. I mean, have all of them in there. But the question I have right now is that the interpretation of this says every quarter. So let's, for some reason, the first or second quarter, it comes up to 6 million, just say that. And then the next quarter, we're seeing some excess revenue. That's the third quarter. So does that mean on the third quarter with that excess revenue, it's going straight to education? But I heard earlier that the interpretation is that it's going to wait till the end of the last quarter or the end of the year. So I just need that clarification that this is quarterly. Right. Yeah.
Okay, well, what I'll do is, I guess we'll take another recess and I'm going to call legal and have her and take a look at it, okay?
Mr. Chair, can I just suggest that
go ahead.
The author of the amendment made it clear that it was her intent to follow the earlier provisions of the same amendment, that they go by quarter. And so I would just suggest that we vote with that as the intent, that everyone understands that's the intent, and that we allow legal later to change it if necessary to meet the intent.
Yeah, thank you, thank you, Senator Terlahi, regarding that. So I am correct, because I heard earlier from 2 other senators that it was at the end of the year, the end of the fiscal year, but I'm reading this as quarter. So if I can, again, Mr. Chair, just verify that with Senator, the author of this amendment to the amendment.
Well, just so that we can get a quicker answer, I'm just a few minute recess. I'm gonna get a hold of Anna. I mean, they're legal, so we'll get a quick answer.
Okay.
We just all be patient so we can resolve this. Thank you.
Yeah, I think it's a
just
bit
take-
of both. It's the quarters, and if
all right.
the 6 million is reached, then it is, but potentially
right.
it's at the very end.
Let me find out from Anna, okay? If you don't mind, please. Thank you. Quick recess. Thank you, my colleagues. I've spoken with legal, and based on the way the bill is written, similar to exactly what Senator Therese brought up. Can everybody hear me? Everybody's good? Okay. It's about every quarter, and then when it comes to education, it'll be equally distributed. But so in other words, after the 6 million, if you get the 6 million in the first quarter, that's it for DPHSS, and everybody else equally get the amount, whatever comes in excess, collected on a quarterly basis and moving forward, maybe also in the first quarter and so forth. All right, so that's the legal's opinion. It doesn't talk about the fiscal year like Senator Tello, you asked. Nope, it's quarterly. It'll stay with quarterly as it was originally written by the author, and then the amendment introduced by Senator Shelton. All right. Okay. I think we covered pretty much everyone here. I just wanted to let you know that I think everyone already spoke. I just got reservation. I personally have reservation with this amendment and even the bill because it misses out public safety. I'm very concerned about public safety. They all interact with all the agencies. All right. So that being said, let's see, was there anyone else that needed to speak? Senator Kelly, you're still there? Okay, I answered that question about fiscal year. No, it's about quarterly only. Okay. Let me see, anybody else? I don't see any hands waved. All right, and just a heads up, Senator Mary is the video wise, she's not on, but she's listening and she'll be able to still respond. And Senator Amanda, if you have technical difficulties, we understand if you drop out as long as you can still respond. So that being said, I would ask Joe Meskin to please take the roll call and let's move on the vote.
Thank you,
Mr.
Mr. Chair.
Senator Amanda, you wanted to close on your amendment?
Please. Thank you.
Okay, please do.
Thanks,
I
Mr.
apologize.
Chair. I apologize to my colleagues for the breaking up earlier, the bad service in my area. But, I wish we were not in this situation and that we voted in favor of the increase of revenues last week so that we wouldn't be in this situation. I think that would have been a much better option for us. However, since we are here, and not actually appropriating the money but doing it this way, I would like to see us make a firm statement that we are prioritizing education in this after addressing the public health concerns that we definitely all have. And so as optimistic as this amendment is, of course, I do ask for everyone's support here.
All right, I think I'm unmuted now. Okay. Joe, let's take a roll call. I think everybody's here, right? Yeah, everybody's here.
Thank you, Mr. Chair. On the amendment by Senator Shelton, on the amendment to the amendment by Senator Shelton, Chairman St. Augustine?
No.
Chairman St. Augustine, nay. Vice Chairman Rigel?
Sorry, nay.
Vice Chairman Rigel, nay. Vice Chair Shelton?
Again.
Vice Chair Shelton, aye. Speaker Munir-Barnes? Speaker
Again.
Munya Barnes. Speaker Munya Barnes, aye. I'm sorry, Speaker, could you just register that one more time?
Okay, third time, Hungan.
Thank you. Speaker Munya Barnes, aye. Senator Lee.
Hungan.
Senator Lee, aye. Senator Teresa Lahi.
Again.
Senator Teresa Lahi, aye. Senator Pidu Talahi.
Again.
Senator Pidu Talahi, aye. Senator Marsh Taitanu.
It's not on here, huh? I answered on my phone.
Senator Pito, there you go, thank you. Okay, anyway, Joe, continue on.
My apologies, Senator Marsh Taitanu.
Aye.
Joe, I said.
Senator Marsh Taitanu.
We already got you, Pito, no problem. We got your answer.
Senator Castro.
Pass, Mr. Chair.
Senator Castro, pass. Senator Moylan.
Aye.
Senator Moylan, aye. Senator Munya.
Aye.
Senator Munya, nay. Senator Vice Speaker Nelson. Vice Speaker Nelson, aye. Senator Perez.
Again.
Senator Perez, aye. Senator Torres.
Nay.
Senator Torres, nay. Senator Taitugui.
Hungan.
Senator Taitugui, aye. Senator Castro.
Hungan.
Senator Castro, aye. Mr. Chair, you have 10 ayes and 5 nays on the amendment to the amendment.
All right, thank you, my colleagues. The amendment passes. Now I think we've had sufficient discussion on the amendment that has been amended, as amended. We will now, does anyone, I don't think there's any discussion needed at this point. We will now move to vote on the main amendment as amended. Right, Joe, let's go. Let's do this.
Thank you, Mr. Chair. On the amendment as amended, Chairman San Augustine.
No.
Chairman San Augustine, nay. Vice Chair Rigel.
Nay.
Vice Chair Rigel, nay. Vice Chair Shelton.
Pass.
Vice Chair Shelton, pass. Speaker Munya Barnes.
Pass.
Speaker Munya Barnes, pass. Senator Lee.
Aye.
Senator Lee, nay. Senator Teresa Lahi.
Again.
Senator Teresa Lahi, aye. Senator Peter Talahi.
Nay.
Senator Peter Talahi, nay. Senator Marsh Taitanu.
Aye.
Senator Marsh Taitanu, nay. Senator Castro.
Hungan.
Senator Castro, aye. Senator Moylan.
Aye.
Senator Moylan, aye. Senator Munya.
Aye.
Senator Munya, nay. Vice Speaker Nelson.
Again.
Vice Speaker Nelson, aye. Senator Perez.
Again.
Senator Perez, aye. Senator Torres.
Aye.
Senator Torres, nay. Senator Taitugui.
Hungan.
Senator Taitugui, aye. Vice Chair Shelton.
Again.
Vice Chair Shelton, aye. Speaker Munya Barnes.
Aye.
Oh, wow.
Speaker Munya Barnes, nay.
Wow, Louise.
Mr. Chair, there are 7 ayes, 8 nays on the amendment.
Thank you, colleagues. The amendment fails. Is there any other amendments to page 7? I think Senator Clint, correction, not Clint, Senator, I'm looking at my sheet. I think it was Senator Jim Moylin. You have an amendment, sir, on page 7. Senator Jim Moylin, where you at? There you go. You have an amendment, sir.
I think we can move that, Mr. Chair, to miscellaneous, so we can continue on.
Okay, so your amendment of line 7 to page 7, you're gonna save that for the miscellaneous, am I correct?
Yes, Mr. Chair. Thank you.
All right, and moving along on the amendments, Joe, what other amendments do we have out there? Mr. Meslin,
Mr. Chair,
Joe?
Mr. Chair, we've exhausted the amendments that were submitted for this
Louise did that.
chapter at this point.
All right, if we can get a update on the total amount so that we have now closed. Senator Kelly, yes, you waved your hand, ma'am.
Yes, I'd like to look at the Moylin Amendment. I was caught off guard this morning. I thought we were going to look at page 81 before we looked at my amendment. And I was told that, ma'am, we're going in order. So I'd just like to at least look at that amendment to see what we're giving special consideration to.
No, basically, Senator Moylin, you're withdrawing your amendment to page 7, correct?
Thank you, Mr. Chair. We had earlier discussion on that. It's better I move that to miscellaneous section. I'll discuss it during the miscellaneous. Thank you, Mr. Chair.
All right, okay, Senator Kelly.
So that's a withdrawal. That's not a, it's not, we're going to come back to page 7 after we're in miscellaneous. I just want to be clear.
No, we won't be coming back to page 7. That amendment will be introduced in the miscellaneous further in the budget.
Okay, thank you for the clarity.
All right, that being said, Steve, if you can give us a total so that we can close chapter 1 for discussion and we can move on to give us a total so we all understand exactly what the total amount is. All right, and we will end up now moving to page 17, my colleagues. We'll be moving to page 17 of chapter 2. Is there any amendments for the Guam Academy Charter School Council? All right, you have an amendment, Senator Tello. I'm looking at my phone. Yes, ma'am. Please, if you have an amendment on page 17.
Thank you, Mr. Chair. Mr. Chair, if everyone can go to the Google Drive. This amendment actually is kind of twofold. It was mentioned earlier that what we're trying to do is we're not going to increase the revenues at all anywhere. I mean, I feel that, you know, OFB has done a great job to try and keep those revenues conservative. So moving forward, I tried to find some funding in the budget bill that would help other places that really need the help. And I came across, so this, like I said, it's twofold. The funding, first, Mr. Chair, if we can all go to my amendment.
Yes, ma'am. It identifies page, line 7, page 17. If you can read it, I think everybody will be able to follow along.
Okay.
Hopefully
great.
everybody's got it, they're on track.
Right, this is, right, this is to change the amended, the amount proffered to the Guam Charter School. I don't know, Mr. Chair,
All
if you wanted to have them on board, or did Joe Masagan say that nobody is standing by to speak on behalf of the charter school before we begin?
No, as a matter of fact, if I'm correct, I think Jesse Kenga, who was the chairman, it's now Vanjie Cepeda. Joe, is she still there on the side somewhere, standing by?
Sir, we're gonna have to get her back on. She's not on standby at this time.
Okay, if you can get her back on, and if you want Senator Tello, we can just continue talking, and then.
Okay, so it tells a story about where I'm finding this funding first and foremost. So what my first amendment is going to do on page 17 is adjust the amount that has been appropriated to the Guam charter schools. And where this happens is by adjusting as well the amount that's been appropriated per student, per enrollee based on actual enrollment. Now, the amount that we gave them in FY 2020 was $6,150.
That's correct.
Yeah, and this year, the amount that we're giving the charter schools is only $6,000. Now, if we were to make them whole based on the amount of students that has been identified in the bill at 1,785 students, and then multiply that by 6,150 per enrollee, you now come up with $10,977.75 and $750. That's a difference of $267,750. Again, that difference is only $267,750. Now that's what my amendment is planning on doing. And like I said, it comes in 3 phases. But how are we going to, of course, the question is, where are we going to get that money?
Yes, ma'am.
Further in the bill, Mr. Chair, under public health on page 38, the foster care group home. In FY 2020 budget, this legislature appropriated $800,000 to the foster care group home, to public health. In this, I've sent, by the way, it should be in docs, in the documents, showing the budget amount that was given to us by public health for the foster care group home in the amount of actually $1.2 million, $1,210,026.43 was actually the budget. But we had only provided them $800,000. Now, when COVID hit, actually it was in December, the group, the Regalu Foundation met with the Lieutenant Governor, Josh Tenorio, to discuss the progression of the group foster care home and how far it's gone. And then we all know that that was in December of just last year. And then of course, we know what happened when COVID hit. The skilled nursing facilities was first supposed to be used, and then they found out that it was not conducive to use it, or the air conditioning was down, that they moved all their testing to the Guam, the foster care group home. And they were utilizing that. So this made it very difficult for them to move forward utilizing the $800,000 that was appropriated to them to begin the group home for the foster children. Now, what I'd like to do is that this year in the FY 2021 budget, on page 38, $760,453 has been appropriated to the foster care group home. Now, Mr. Chair, I spoke with Public Health, Tess Archangel, and received this budget from her. I also spoke to the Regalu Foundation as well. And if we were to take some of the $760,453 that was appropriated to the foster care in the 2021 and only make it $492,703 instead, so making an adjustment there, and taking that balance over to the charter schools to make them whole and have each enrollee at $6,150, not only do we make charter schools, which has been proven to be, producing students with high test scores, and you'll also see a testimony from Dr. Velma Sablan from the University of Guam, who provided, and I think that was sent to all the senators as well, to look at the numbers and the test scores and how well the charter schools are doing. So it would actually make whole the budget for the foster care home by giving them, instead of 760, 453, the 800,000 that they received in appropriation, which again will do the third thing, allow that appropriation to carry over into FY 2021. I know there's a lot of information, but all this has a domino effect. If we're going to increase the charter schools to make them whole again, with only $269,750, make them whole, make the foster care home by providing the $1.2 million that they requested for, then it's a win-win for everybody. The foster care home will carry over the 800 plus the additional 493, making them whole, as well as the charter schools, each student getting 6,150. So that's why it's kind of like three prongs and a domino effect with respect to what my first amendment will do. So again, to my colleagues, the first part would be to adjust the $10,710,000 and adjust that. So that's the first amendment. And I humbly ask for everyone's support. We're changing that to $10,977,750 for the Guam charter schools. That's the first amendment. And if you have any questions, of course, I'm here. I'm probably confusing going from step 1, step 2, step 3. So open for discussion.
Thank you, Senator Tello, for finding the source of funding. I appreciate that. But I'm going to ask Steve to please comment in identifying that funding. I see Senator, Madam Speaker's waving her hand, but I want Steve first to comment about that so we can get the funding right and that we're okay. And then we'll go down the line. And then just to let everyone know, we do have Mr. Kenga and Ms. Vanjie Spade is on. And if we can, for about a minute, we're going to have our Sergeant Arms swear the two in so they can be able to speak and comment. All right. Sergeant Arms can we get Joe? Can we get Vanjie and Jesse on live so we can see them? And there you go. I see Vanjie there on the left. I just need to see Jesse now. Get Jesse live, and then okay, we got Jesse here. We got Vanjie. Sergeant Arm, Tom, if you can go ahead and swear the two in so that whatever we're discussing is all right.
Okay, Mr. Chair. So for the two members, can you please raise your right hand? Okay. Under penalty of perjury, do you affirm that any and all information that you provide today, whether it be verbally, electronically, and in writing, be the truth and nothing but the truth, so help you God?
I do.
Mr. Kenga?
I do.
You're okay. Mr. Chair, they're under oath.
Okay, thank you, Senator Arm. Senator Tello, before we go on, I would ask Steve if he can please speak about that. And I'm in support of what you've identified, Senator Tello. I've been trying to figure out where we can get money for them to make them whole. Steve?
Yes, Chairman. The amount that the Senator technically mentioned regarding the is correct. There is an appropriation in the bill for $760,453. That is the amount that's budgeted for the foster care for 2021. There is an appropriation of $800,000 that was appropriated to the foster care for 2020. I believe, looking at the system, I don't think there's any expenditures charged against that appropriation. So, that being said, if the 800,000 is allowed to be carried over into FY21, that money would be available to them, which I believe is the amount needed for a 12-month period, which would be sufficient to cover their program for FY 2021, unless they have an increased enrollment in participants that would require an additional amount over the 800,000.
So
Senator,
yeah.
so Senator Tello's assessment of these two figures are correct.
All right, so basically, Steve, based on what Senator Tello was bringing up, was to carry over the 880,000 and then add the 492, which comes up to 1.2. If I'm correct, Senator Tello, I think that's what you said earlier, ma'am?
Yes, Mr. Chair, based on the budget by Public Health for the foster care group home, the amount they need really is $1.2 million in order to move forward, as well as the Regalo Foundation has already provided like furnitures and fixtures that they've been working on at the beginning of this year to submit. So a lot of the stuff that in there will be subsidized by people's donation for these foster children.
All right, okay, thank you. That being said, maybe we can ask that question of the two board members or council members. They can comment to that effect, to exactly your proposed amendment, so that everyone can hear that, and then we'll go down the line because I have the speaker ready to speak on that. Senator Tello, you might want to. I think they look forward to that making them whole. No doubt about that.
Thank you, Mr. Chair, and thank you for Vanjie for participating, as well as Jesse for participating and advocating for the students at the charter school. So your comments are very much important to this body, as well as to the parents of these children. So thank you for being here, and please, Mr. Chair, if they can make comments, I appreciate it.
Yes, please. We'll begin with, who's the chair now? Is it you, Vanjie, or is it still Jesse? If you can unmic, so the unmute. You need to turn it on, Vanjie. We can't hear you yet, Vanjie. You need to unmute your. There you go. Oh, you had it. Try one more time.
Okay.
There you
I apologize, Mr. Chair. It is I was just elected to the board as the chair 2 weeks ago. So yes, I am the chair. I would like to say on behalf of Senator Tello that I am in full support for the 6,150, because I know that we are working around $6,000 per pupil, and that I'm not going to be ashamed to ask if we can get 6,150. I'm going to say thank you, and we need it. We need it. The charter schools is a really positive. They have different programs for each charter school. They represent a different group of students, and not every student works the same way. So I will say that as the chair, and I do have Mr. Jesse, who is my predecessor, wonderful man, on board. We're in support of the 6,150.
All right, thank you. Jesse, would you like to comment to that effect, please?
Sure, thank you, Mr. Chair. No, absolutely. I think any type of support that can be identified by this committee to support charter schools further would be a needed response, definitely, to all schools. What I might also want to contribute for discussion, if there are other funds made available or that can be appropriated, we do know of two of our schools that would love to see an increase in their enrollment capacity, specifically iLearn Academy Charter School and CIFA Academy Charter School. In the proposed budget, CIFA Academy saw their enrollment cap drop from the 350 in FY20 to 325 students. For iLearn Academy, what was discussed with the council while I was still on board was that they had enrolled a number of students. I believe that they received over 167 additional students. 50% of that are from kindergarten students. And so if there's any capacity for this committee to also consider at least funding for the 70 kindergarten students for iLearn Academy, that would be most appreciated as well. But any type of discussion, I think we're proud to hear of the senator's opportunity to find this adequate funding to help bring us back to the 6,150 per pupil. And we'll be happy to provide any other information as the members.
Well, Jesse, do you have the cost? Because Senator Teller would love to know what the cost is, so if we're looking for money and we all find it, we can identify it. You have a cost when you mention like CFA. I know they were at 350. I think they're dropped to 325. So we're looking at 25 more students, and we're looking at iLearn, right? And you also have Guan Academy. So what is the total number of students? Because we get the total number of students just times 6150.
Right. So at the very minimum, if we could see 75 students, that would be 50 for iLearn and then 25 for CFA. We can do that by the 6150. The total costs, I'm just doing the math here, would be $461,250.
All right.
Yes. Thank you, Jesse.
Okay. Thank you, Jesse. Now we'll go down the line, but I'll start with the speaker. She had her hand waved first, and I'll come back to you, Senator Clint, my vice. Madam Speaker.
Jesus Maasi, Mr. Chair, for giving me the opportunity to speak. And I please just want to note for the record that I just want to make sure that there's no unintended consequences here. I was a really big advocate for the foster care home as the author of the legislation, and also was the co-sponsor of the charter schools. So I just want to make sure that that everything's in order here as it relates to the federal government. And given that the federal government has funded the foster home, I think I want to ask a question to either DOA or the clearinghouse. If these funds were taken away from that, what would be the impact with this on the grant obligations? And I just want to make sure, because I feel that I don't think the feds would be okay with this, allowing us to build, saying, okay, we built the foster home for you, and then we decide to change our minds. And like I said, as one who was the co-author of the charter schools, and I support the charter schools, I just want to make sure that as we look at this vision moving forward, and from what I can see here is, I want to make sure that there's no unintended consequences. So Mr. Chair, maybe the clearinghouse or Department of Administration can share their thoughts with me, or I guess anyone out, even the council, because I think it's really important that we don't take away from any of the grant obligations that are out there, especially when the amounts were previously approved and that the federal government was aware of that. So when you take away from one grant program and try and utilize it elsewhere, that may have some unintended circumstances. So please, Mr. Chair, if I can be allowed to ask that question from either DOA or clearinghouse.
All right. You want to ask that question from the clearinghouse or from DOA? Unfortunately, we weren't able to get them on. I don't know why they weren't able to get on with us today.
Yes, and Mr. Chair, I think it's really important, because as we look, and I appreciate the amendment from the author from Agania on this amendment. I appreciate that. But as I look at Chapter 2, we were looking at upping it from 6,150. Right now, Chapter 2 says 6,000 flat. So you take the 150 and add so that I think that's more than what the request is asking for. I don't have my calculator with me right now, but I just wanted to make sure, because chapters 2 shows 6,000 flat on charter schools for the 4 charter schools per student. And I thought I heard the amendment say 6,150. I know that was previously done in the past. So if there's anyone, or even, I really think that I want to get at least verification. Someone can make a call.
Mr. Chair, may I ask a question of the speaker? I don't, is it okay, Mr. Chair, if I
You're gonna,
try
you're gonna,
to
you're
answer
gonna be able to answer the question? Okay.
I just want to try and understand the question. Your question is, am I making an amendment to, okay, let's go back to the other question about bringing clearinghouse in and stuff. You talk about taking away money because it's going to jeopardize federal funding. I didn't quite understand what you're talking about there, Madam Speaker. You're on mute. Yeah.
Yes, Madam Speaker, I think you mentioned about the question of the grants that are out there. Yes, ma'am.
Mr. Chair, I'm very clear, and I addressed the question for DOA or for the clearinghouse, the federal clearinghouse, because I think it's important. I support both programs very much. I am the author for the foster home and also for the charter schools. And I just want to make sure that if we're taking from Peter to help Paul, that we have the opportunity to say, to make sure that there's no unintended consequences here, because we're pooling based on what was previously approved for the grant support and for the building of the facility and for the program. So I just want to make sure we're clear, because this is very, and then I just also want to do that point of information. I'm not asking that they're taking anyone. I'm just noting that on chapter 2, on the charter school component, page 17, the amount by OFB is 6,000 straight. And I know that it was mentioned that it would be back to 6,150. So I just wanted to make sure if that was the correct amount, because if we're going to up the amount, I wanted to make sure that was cleared, because we did ask for support to OFB to increase the amount from 6,000 to 6,150 as previously approved. And I know that
That's
it was
correct.
based on the numbers that were capped, and I know that CFA that was at 650 350 went down to 325. So I just wanted to make sure that I'm not in opposition of anything. I just want to make sure that we get that verification.
Just a point of
Yes,
information.
as a matter of fact, Senator, stand by. If you look on that page 17, when she asked the amendment, I think her amendment needed to include section 3, the 6,061.50. And I understand that's what her intent was, but I think that amendment needs to be included. And I think that's what you're pointing out, because it shows the 6,000. It got to reflect that the line 8 on page 17 of 10,710 be changed to 10,900,000 and so forth. And it has to reflect that on line 15 on page 17, it reflect the 6,000 to 61.50. Am I correct, Madam Speaker? That's what your
Yes, Mr. Chair, I just wanted to make sure that the numbers are correlating based on the request, because we reduced some of the, one of the charter schools numbers, and we capped the other 2. And then we have a new program, which is the 100 students for career high, which was capped at 100. So I want to make sure that the numbers are correlating based on the amount of the amendment that is asked for right now. So
yes.
So two-pronged approach, because of I wanted to make sure that there's no unintended consequences. Again, supporting the intent, but wanting to make sure that we don't put in jeopardy either program.
Yes, ma'am. I understand that very clear. As a matter of fact, Senator Tello, you wanted to comment before we get everybody to start lining up to comment?
Great
Please.
point of information, Mr. Chair. One, the foster care home is up and running. I mean, not up and running. It's up and ready to go. They just need to get the contract to have someone come in and run it, the facility, as well as provide any kind of equipment that's needed. So the building has already been finished and done and ready to go. Then the next step now is putting out an RFP for a contract for somebody to service it, an agency to, or a nonprofit to go in and run the facilities as well. Mr. Chair, I have two amendments, of course, on page 17. I'm just showing you the first amendment that I have up that strikes out the 10,710,000 to read 10,977,750. Then my second amendment would be to strike out the on page 17, line 15. And I have a second amendment that's already in Drive that strikes out 6,000 to make it 6,150. That's the only amendments I have on page 17. No other amendment than that. Those are the amendments.
Okay.
Mr. Chair,
Oh,
if
okay.
I may, I'm just asking for clarification first. I definitely, like I said, support the programs. I want to make sure that if we take it from one program to put it on the other, that we don't have to repay the federal government for the money that they put in for building. And I know that the facility is done, but there was a formula that was provided through the federal government and the government of Guam. So I'm just asking for that. And maybe this is a time to take a moment's break so you can get the answers from the clearinghouse.
All right. Okay. Yes, ma'am. The Oversight Chair for Public Health should be able, hopefully can answer that a little bit. If not, we're going to go ahead and pause and try to get a hold of the clearinghouse and make sure we're not in any grant violation or any jeopardy of having to repay anything back. Senator, do you have something to add about the Regalu? Yes, ma'am.
Yes, Mr. Chair, as to this amendment. So it's my understanding that the building was federally funded, as the speaker said, yes, but that there is no, I don't know, they've never requested funds, as far as I'm aware, for the building purposes. The funds that they are requesting is for operations, for the contract to run the shelter, just as they run the other shelters. And so we have given them $800,000 to do this last year. That was their estimate at the time. And their estimate is now 1.2 million. I agree with the sponsor of the amendment that they need that money and we need to get it to them. What I don't agree with is, and I agree, well, what I don't agree with is that we're going to cannibalize public health, who's $13 million short in operations, $9 million short in order, of funds that can allow us to access Medicaid and CHIP. That, if you want to get this money, then please get it somewhere else, because we've already laid out that public health is short. And we're talking about, the amendment is approximately 200,000. And it looks to me like the charter schools, now I don't object to giving them more money, but I very much object to it coming out of public health. The charter schools were given $193,500 increase in this budget compared to fiscal year 20. I'm not sure why, OFB reduced this amount to 6,000, but the whole theory behind the public schools was, the charter schools was that, it was going to reduce the cost of DOE. And so that, that's why the money was coming out of DOE's budget for a long time, that, when we allow a charter school to open, then we recognize that we're moving money out of DOE in order to run that charter school the way they want. And of course, that's what DOE has brought to our attention, that it's having an impact on DOE. And I don't think anyone at the charter schools wants to have a more negative impact to public health than what we are already facing, Mr. Chair. So I agree that the foster homes, thanks to public health, saving that 800,000, because they intended to open in March, Mr. Chair, if I may remind you. they were just finalizing the RFP. And then, you know, we came upon this pandemic. Well, first they had the fire. And so of course they considered using that building as part of their operating, but they decided not to. They were going to open the shelter. They moved out of their building. They had to address the fire, you know, repercussions. And then the pandemic happened, and I was first told they were going to use that shelter that was ready to go for sheltering responders, or, you know, the healthcare professionals up at the SNU, that type of thing. I think I shared that with you all. But then it ended up being used as the central health facility in lieu of the burnt down central health facility for COVID testing and other, you know, health care, for actual health care. And so that's what they used it for during the pandemic. So, you know, I too am anxious for them to open that shelter up as fast as possible. They said they're ready to do this. And however, they've asked us to preserve the money that's allocated to them in this budget, in the budget before us, the bill before us, because of their tremendous shortfall, so that, and to allow them to use that, these special allocations, that they want that restriction released, so that if they have more than they need for the shelter, that they can use it to address the other shortfalls in their operations, Mr. Chair. So that's the only reason I made this amendment. If you can find another funding source, or if they were supposed to receive $6,150 from the start, then yeah, I would recommend that we find that elsewhere. That's why I don't want to cannibalize one budget for the another. Particularly, I don't want to cannibalize public health's budget. Thank you, Mr. Chair.
All right, thank you. We're going to go down the line. Senator Tello, go ahead, and then we're going to go down the line for everybody else to speak, okay? So.
Thank you, Mr. Chair. Just a point of information. The increase to charter schools wasn't due because it was just given an increase. The reason why it was increased is because another school came on board. And that's why the numbers went up higher, because of a new school coming on board. That's all, Mr. Chair. Just wanted to make that clear.
All right. Okay, thank you. Senator, we're going to begin with Senator Clint. And then at the same token, Madam Speaker, I do have our staff trying to get a hold of the clearinghouse so we can comment about the grant, because I know that's an issue we do need to get an answer.
Mr.
Okay,
Chair,
Madam Speaker.
please, I just want verification based on that,
Yeah,
because
that's
we
what they're going to do.
have good programs, and I don't want to jeopardize one over the other. It would not be fair. It would not be fair to take money from our poor children. Please, I'm asking for that.
Understood. Thank you, Madam Speaker. Senator Clint, if you would begin, any comment? None. Senator Shelton, my other vice. Ma'am?
Thank you very much, Mr. Chair, and I appreciate the amendment, the intent of the amendment, and also the Chair of Health, the explanation. And of course, I want to see as much support that we can given to the charter schools. However, I'm also the chair of youth, and I'd like to make sure that we're not going to negatively impact the operations of the foster care home. And so, Mr. Chair, I'd like to respectfully make a request to have public health on this call as well, to be added to this panel, in addition to the clearinghouse, so we can understand how better this impact to them.
All right, Joe, if you can give them a call, and then we can work from there as soon as they come on, and then we'll come back to you, Senator Amanda. Moving down the line, Madam Vice Speaker, do you have any comments you want to add to this to support the?
Thank you, Mr. Chair. I do share the sentiments with the Oversight Chair of Health and also the Oversight Chair of Youth, that we bring in Department of Public Health to really understand if the impact. I'd like to commend the author of the amendment for, looking and reaching for creative ways to fund charter school back to $6,150. But just to understand the realities that we are faced with, it would be good to hear the agencies that we are looking to move this money from, in order to support the charter schools with an extra $1,000. Thank you.
All right, thank you. Senator Lee.
Thank you, Mr. Chair. I agree with the Vice Speaker, and I'll hold my questions until we get public health on. Thank you.
Thank you, Senator Kelly.
So Joyce Mossy, Mr. Chair, and forgive me, I've been trying to follow really carefully. At the very beginning, there were a lot of numbers, and I was scribbling them down as quickly as I could. I definitely appreciate the, what the author of this amendment is working towards. And so I just, at least at this point, the question that I had, and maybe I missed it in all the different communications, but have the max number of students per charter school, was that part of the calculations? I just want to understand where we are with the numbers. So if the author of the amendment could let me know, just remind me how many students you were calculating for, and if that's the max number of students for all the charter schools.
If it's okay, Chair. I don't see him, Mr. Vice. Okay, is it okay, Joe, to answer? Okay, thank you, Mr. Chair. Thank you for that question. I apologize because this amendment, has a domino effect. One has to work in order for it to all work. And it's definitely not taking away from the foster care home. In fact, we're making them whole at $1.2 million. And as far as the charter schools are concerned, the numbers that you see on page 17 for each charter school, that's a total of 1,785 students. And that's identified by each school. I Learn Academy, 740 students for Guahan Charter Academy, 325 for that student. The Science is Fun and Awesome at 100. And if you add all that up, it comes out to 1,785. And what I did was I simply just, instead of 6,000, made it 6,150 for 1,085 students. That is identified already in page 7 on the charter schools. And again, as I mentioned earlier, one of these charter schools are new to the appropriations, and that's why the increase went up. And
500,000 for the removal of middles, right?
Pito, oh there, okay. So yeah, did that answer your question, Senator Taitano?
Yeah, sorry. So just to make it like super clear. So with that new charter school, they probably are farther along than I last saw, but they had like 15 students. And so I'm not sure, like I downloaded the foster care one, and maybe I missed where you were saying that the charter school information is. But I just want to make sure, like, especially for that new one that was at 15, however many days ago, that their max capacity for them and all of them are part of that 1,085. So that maxes everybody out?
No. Senator Tello, and let me respond.
Okay.
Senator Kelly, if you look at the page 17, you'll see what their numbers are. That's their numbers.
In the budget bill? Okay.
In the budget bill, page 17, please let folks, let's follow the page. You'll find it. You'll find the numbers that Senator Tello keeps reiterating. The numbers are there for Guan Academy, also for iLearn and so forth. All right, and two of the charter schools wanted an increase, and because of our budget shortfall, the COVID, we couldn't give them that. And initially, when OFB was looking at these numbers, they initially was starting at a possible 4.8% or 5% reduction, and then we kept trying to find funding somewhere. We got them from 6,150. What initially was going to be 5,800. We got it up to 6,000. We were trying to find, and I wasn't looking at Regalo, but Senator Tello is offering that, and we're waiting for my staff to get a hold of the public health folks and the clearinghouse to make sure the grant is protected. The house is built. Yes, the house is built, but we don't want to get bitten that the house is built, then we have to pay back because we didn't get to use it. So moving along, Senator Kelly, the numbers are there. The two amendments are there to the amount and the number and per student rate. All right.
Okay, so yes, I found the numbers. We have so many documents and amendments open. I needed that clarification. And so it does look like all the maximums as we know them right now are accounted for. So that was my main question, but I'd like to reserve any time for a follow-up depending upon how we go. And
Yes.
I do appreciate that we're looking out for grant integrity, just to make sure that we're dotting all our I's and crossing all our T's. And I know the author of this amendment would want that too. So,
Yes. All right, thank you. Senator Pito Chirlai, do you have anything you want to bring up?
Thank you very much, Mr. Chair. Let me just say that I want to support public health, and I want to support the charter school, and I want to support the foster care program. So what we need to do now, Joe, is just to find ways on how to split up the money if we can. But most importantly, we need to really take care of public health, man. Okay? Thank you, Joe.
Understood. Thank you. And Senator Teresa, you spoke earlier, so I'm going to go ahead and pass you. And we've heard you and what you said.
A question,
okay.
Mr. Chair. Is
All
there
right.
a law? What does the law provide for the charter schools? Did we deviate below that law in this appropriation?
No, we didn't. As a matter of fact, we identified what funding was available. And based on that, we were able to stay away from going any lower than 6,000. If you remember before, it was a lot less than that, and it was growing slowly because the economy was growing. But when the economy during the COVID, everybody took a bite, so we had to make sure there was balance and equity across the board. And OB went through and says, and this was looking at 5,800. I said, no, we need to find something because they can't survive with 5,800. And we got it up to 6,000. And I did brief the charter schools, and I'm in full support of the charter schools. There's no doubt about that. I was in the Board of Education. We had problems with that back then, but it's all fixed. But no, we didn't deviate. As a matter of fact, the authorization of the number of students, if you look at it, the number of students that were provided, I know that CFA, and CFA is a great charter school because they started on their own. They didn't need any government funding when they first started, but they were authorized 350. And one of the biggest thing, and Jesse Kang is there, is that they weren't reaching that student population. See, the other two schools did, and they're ready to exceed that. So we were trying to make sure that everybody, once you reach your ceiling, you're good. If there's more money, then we'll find ways to appropriate it. Unfortunately, CFA, at the time when Mr. Kenga, when we were talking about it, they were at, I think, 302 or 308. So we're trying to bring some level playing field. I didn't want to touch CFA, but we had to. And then we moved on. We also talked to the Career Tech, where they asked for 200, and we didn't have the financial ability. And I think Mr. Kenga reached out to them and let them understand that we want to support them, but the ability financially to support them was not possible. So 100 students is what we eyed for them, and everybody was able to go into business and stay afloat. That was the only thing we did. Okay, Senator Teresa, is that good?
Yes, thank you.
All right, thank you. Senator Sabina Paris, ma'am.
Yeah, thank you, Mr. Chair. I think this was a lot of good work on the part of the amendment. I just am weighing also the issue with how Department of Public Health is in need at this time. So yeah, just that's all I wanted to comment at this point. Thank you.
All right, thank you. And we have now Senator, not Telotarigo, you're the author, Senator Torres, ma'am.
Still here, Mr. Chair. No comments. I'm just very good dialogue. Thank you.
All right, thank you. Senator Moylin, Jim.
Thank you, Mr. Chair. If I may hear from Jess on this amendment, please.
All right. Okay. You want to hear him again? Okay, he's in support of it, but okay. Jess?
Yes, thank you, Mr. Chair. No, absolutely. I think any consideration to provide our schools with the opportunity to go back to 6,150 is most appreciated. I think the discussion is healthy. We appreciate the efforts by the author to go in and find where they could cut in order to provide for this fund without adversely affecting the other party. But again, I think what we also want to raise, if there is an opportunity to discuss an added amount, I shared that there is a 461,000. Let me get that true amount. 461,250. What we would like to see is the actual enrollment for iLearn Academy Charter School is 767 students. The bill currently proposes just 620. So if we can upward adjust their enrollment capacity, it doesn't need to meet their actual enrollment, but just 50 students, that would help to eliminating their deficit.
All right, and Senator Moylin, I'd like to just emphasize that Ms. Vanjie Spit is now the new chair. She's the new chair. She's the chairperson now of the charter school. Mr. King is now, he works for certification office now.
Oh, okay, I appreciate that. I was just basing it based on his public testimony at the hearing, but my apologies, Vanjie, but thank you very much.
Oh,
Thank
don't
you,
worry about it, Senator. Not a problem.
All right,
It's a team
we're
effort.
good, Senator Moylin now?
Yes, thank you, Mr. Chairman. Thank you.
All right, Senator Castro, sir.
Hey, thank you, Mr. Chair. I want to rise in support of the amendment, especially since the sponsoring author identified an offset. And I want to thank you, Vanjie, the new chair, for your advocacy, and I appreciate the fine work that you folks are doing. It's a lot of work. Thank you as well, Mr. King. So no objections, Mr. Chairman. I encourage my colleagues to pass this amendment.
Senator Munia, ma'am.
Thank you, Mr. Chair. Thank you. Thank you. I'm here. Yeah, no, I again, like, Mr. Chair, like you said, that the opportunity for us to fund or increase an appropriation in one area, we need to go in and do our homework and figure out where we're going to take it from. And so I commend the author of this amendment for doing exactly what you had instructed us to do from the very beginning. If we were going to take from somewhere, or if we were going to put something somewhere, we need to figure out where we're going to take it from. So I do commend her for doing her homework and figuring out how we can best appropriate more funds into the Guam Academy charter schools. I'm a very big fan of theirs, and I do know that there needs to be some balance in how we fund each child, no matter where they go, whether it be public school or charter schools. And I really think that there should be a balance there. So I do look forward to having that dialogue again with public health and anyone else we need to discuss this with. But I'm in support of this amendment. Thank you, Mr. Chair.
All right, thank you. And we do have the director, acting director, Arthur Snows. I see his name here. So Joe, if we can get him on live so he can comment in reference to the page 38 on his area, in his budget. Art, are you on? Where'd he go? Oh, there he is. Mr. Snogzim, sir. Can you turn on your mic? Good afternoon. We have an amendment on the floor to take approximately reduce on page 38. I don't know if you have a copy of the budget bill, but it's in the area of the foster. Yes.
My apologies. Kindly wait for Sergeant at Arms to swear the public health and state clearinghouse individuals in. Thank you.
Okay, we have the state clearinghouse folks also. Oh, great. Okay, I see Art. And who's the state clearing? So, okay, we got Stephanie. Okay, Sergeant Arm, if you could please swear the director and the state clearinghouse person in charge, Stephanie. Go ahead, Sergeant Arms. We need, wait, let us unmute you first. Joe, unmute Tom so we can know that he's alive.
Where's Tess? Marianne?
Hello?
There we go. Here we go.
Okay. Can I have all the individuals raise their right hand? Okay. Under penalty of perjury, do you affirm that any and all information that you provide today, whether it be verbally, electronically, and in writing, be the truth and nothing but the truth to help you God?
I do. Yes, I do.
Okay, Mr. Chair.
Okay, thank you, sir. Thank you, Sergeant Arms, Mr. Snogsby, Ms. Stephanie, and Ms. Teresa. Right? I think the question was posed by the speaker in reference to the grant that built the Regalo. Madam Speaker, I'm gonna allow you to ask that question before, and then we'll have Art respond to the amendment that Senator Tello posed. Okay, so we can clear the issue of the grant on the Regalo. Madam Speaker. There
Thank
you
you,
go.
Mr. Chair, and I thank Public Health and Clearinghouse for being here. My question was to make sure that given that the federal government has funded the foster home, I wanted clarification from DOA or the Clearinghouse if taking away these funds to put into charter schools, will it impact our grant applications? And I know from supporting both programs, if the feds allow us to build something and it's our obligation to operate, and we change our minds, of course we may be forced to repay those federal funds. And in the same token, I just want to make sure that there's no unintended consequences here. As the author of both programs, and as far as the foster home and then the co-sponsor for the adoption for charter schools, I wanted to make sure that we don't take from Peter to help Paul, but ruin a program that we fought so many years and so hard for, to make sure that our most vulnerable children with no parents was going to be taken care of. And so I asked if we could have Clearinghouse or DOA or now Public Health, if they can share that. I also wanted to state for the record that I support both programs. I personally support both programs, but I want to make sure that we don't have any unintended consequences here, because we want to take from one program and give it to another. So if anyone can help me answer that, maybe start with the Clearinghouse or Public Health.
Yes. Good afternoon, Madam Speaker. Before we start, happy birthday.
Oh, thank you very much, Jesus Wasi.
Insofar as the foster care home, I understand that the subject of the amendment is to remove some of the funding in the current substitute bill that's meant for the operation of the facility, and to take it over and put it under the charter schools. Is that correct?
Yes.
I do have concerns about doing that. Because the intended purpose of that facility in Barragata Heights was to be a fully functioning foster care home for children who would not otherwise have a place to go. And when we entered into the agreement with Department of Interior, we assured them that we would be able to fully operate that facility. Okay, so I know that there was a temporary use of the facility that was allowed by DOI for this time during the COVID, but it needs to be returned as soon as possible to its intended use. There are some repairs and things that need to be made to that facility to bring it up to a safe standard for use in that facility. So I would just ask the body to please consider that our agreement with DOI is to adequately fund that facility so that it is operational for its intended purpose. Otherwise, we may have to explain to DOI why we're not doing that, or why we're not adequately funding it, which is our agreement to do. When we ask them to give us money to do something, we assure them that we will do and carry out to the best of our abilities the intended purpose of that fund. So I would just ask the body to please consider that those obligations need to be met. I am a great supporter of charter schools, and I think they're a fantastic addition to our public education system, but also You know, it took a long time to get this foster care home to where it needs to be, and we cannot jeopardize that going forward.
Mr. Chair, can I also ask Public Health to engage, and if Lester's there, if they can engage?
Yes, please.
Art?
With regards to the foster care, I have Tess Archangel. She's our division chief for the Division of Public Welfare, who has the details with regards to the operation of the foster care program. So if I could please have her speak on this matter. Thank you so much, Tess.
Okay, who's gonna speak? I need to unmic. There you go. Or unmute.
Tess,
Okay. Yes. Okay. We would like to request the senators to support the budget of the foster care group home based on our estimated program costs. That includes operational costs, administrative costs, that includes the utilities, the insurance of the building, as well as the shelter workers, the appliances, the furnitures. We came up with $1,210,26.43. So in order to fulfill the grant, we need to have an operational cost and admin cost. So we would like the senators to support this funding.
Yes, yes. Okay. Well, that's currently in discussion, ma'am, that Ms. Archangel, to maintain a rollover your budget, carry over the labs of 800 plus the remaining 400,000. So we are identifying the 1.2 million.
Thank you so much.
Okay. Madam Speaker, do you have anything else of the three individuals? And if not, we can move along. I need to unmute, Madam Speaker. There you go.
Mr. Chair, if I can also hear from the administration and BBMR based on that request. And again, Mr. Chair, I must say that I support both programs. And I think it's important that we give to both, but I cannot see from taking from one crucial program that we need to get going, or we may jeopardize the opportunity and have to return the money to Department of Interior for trying to suffice a charter program that I support 100% as a co-author of the inception of the charter schools. And you know, I was told that I should do my homework, and my homework is I cannot fathom the fact that we're taking money from those kids that are most vulnerable without any parents to be able to try and suffice. I want to find the money for the charter schools. I just want to make sure that it doesn't impede on the program moving forward for the foster care home and those kids that need it the most. And so if if Adelup, DOA or Lester can chime in, I'd like to know what the thoughts are from their perspective.
If I may.
Well, unfortunately, Madam Speaker, they're not on. Joe, did we ever get a hold of them? Otherwise, we have Mr. Art Sinogsin, the Director of Public Health, that maybe hopefully be able to answer that. If that would threaten any of the children, the folks.
Mr. Chair, we did send the information this morning, and there was no confirmation that they'd be participating.
Okay, so Art, maybe you can answer that. We don't want to jeopardize any of the children, and we understand where the speaker's coming from.
Yes, understood. Good afternoon, members of the Guam Legislature. In regards to the discussion of the foster care group home, 200,000 is significant for its operations. This is a proposed budget, and although we are looking at 1.2, there are other variables that when you come down and you actually acquire equipment, you actually start negotiating for the operation, it may exceed 1.2. And so you also have the prevailing wage. Whatever the prevailing wage is by public law, we have to meet that requirement. And so what has happened many years in prevailing wage is there's a cap for a program. The prevailing wage goes up and it increases the cost for personnel. but you don't have additional monies to cover that. So you basically pull from your operations, from your supplies. And this program is so significant, and it's a project that we want to fully support. And not knowing really the data in terms of us operating and engaging in a contract for this service, we need all the funding that's there. I'm in not in opposition, of course, to any of the other projects. It's just for this project in particular, the 200,000 was necessary because we don't actually have a budget. We're thinking 1.2 is sufficient. It may not be sufficient. And then, of course, you'll be questioning why we didn't object, or we didn't support or we didn't make note of our request to not defund or lower the amount of this program. It's necessary to maintain that additional, or the identified 200,000, because there's a lot of unknown costs. We're just starting to open the facility. And if we had the facility operational, and we had data that said, okay, this is the average cost for food, this is the number of kids that come in, this is the number of supplies we need, then we'd have some historical data to rely on. But I don't have historical data at this time. And although this is foster care and looking to move it to a charter school, I think you can all agree also, as you have said, Madam Speaker, taking from Peter to pay Paul, even if you take it from our foster care, which I ask that you don't, the department overall is short. We're short in the millions. So if you were to move it purposefully, and given our cap within the budget, I ask that you move it and keep it within public health, because public health in other areas is short in the millions. Now, if we were short in a couple 100,000, that would be a different scenario, but we're short in the millions. And so really all that's doing by removing 200,000, if there was 50,000 left after Tess is done with acquisition of supplies, equipment, beds, furnishings and whatnot, we have, let's say, 50,000. That's a small amount for the overall, we're short in the department in the millions. So, you know, there's a lot unknown about the actual cost. I've negotiated with contractors before who are doing like emergency homes, food program, and the cost just continues to go up. And so health and welfare goes up, the cost of the contract goes up. I need a little flexibility with this contract. We want to be sure it's a 24/7 operation. So you need staff 24/7. We got to pay for that operation, and it includes meals, weekends. School's not in right now. If they were in the home, we would actually be paying for, we'd be buying their meals, breakfast, lunch, and dinner, preparing for that. We would probably also be having to acquire computers, which Tess really, you need to think about these days because of our current COVID-19 situation. Probably have a section in the place equipped so that we could have distance learning in the facility. And I'm almost certain that wasn't factored in the original expectation or projection of the budget because we weren't looking at COVID-19, I imagine, when that budget was put together. So there's other added costs given the COVID-19 situation, distance learning, and that we really haven't have a firm budget for this. This is an estimated budget, and I ask the senators, please, for the foster children of Guam, this is one chance we get to really know the costs, allow us to keep the funds so that we can fund that program. And I hope that it's actually sufficient. I wouldn't be surprised that Tess comes back and says, you know, we're kind of short. Just operating a home 24/7 with kids, it's a very expensive operation. So I hope that you would consider that and keep the funding in the foster care group home program. Thank you.
Thank you. Mr. Chair, if I may, maybe my other question would be to Stephanie from the Clearinghouse. Is if we felt in violation because the funding was removed, how much would we have to take out from our coffers to pay back the Department of Interior?
I don't have the exact number in front of me of what they paid to build the building, but you basically have to repay the construction costs. But I can get that number to you.
Please, I would appreciate it. Mr. Chair, I want to thank you, and I will continue to hear from my other colleagues, but I know that Art has an update.
Yes, he's waving. Art, you have something, Mr. Art?
When we use DOI money, the DOI money funded about $4 million to build that facility.
Okay, and
And so Senator Barnes was asking approximately how much would we end up having to pay back DOI if we had to.
Right.
If we had to, yeah, but that was not really the
No,
intent, was
sir,
to worry about
Mr.
the
Chair, I
threat,
just
but
want to make sure that because we've committed to Department of Interior building the facility and the program needing to move forward, we want to make sure that we protect the integrity of that and not fall short if we violate the provisions of us having to operate the program 100%. And if we had to pay it back based on what they've put in, I don't think that Guam has the $4 million to pay back because we were trying to take from Peter to pay Paul.
understood. Thank you, Madam Speaker. Senator, I think we covered everybody, but Senator Tello, the author of the amendment, wanted to ask Stephanie and probably the folks questions. Senator Tello, please, so we can
Thank you,
wrap this
Mr.
one up.
Chair. Thank you, Mr. Chair, and thank you, Stephanie and Art and Tess Archangel for being here today to answer the questions. And Art, I want you to know I'm not taking away from public health with regards to something that's going to really make a dent into the foster care home. Have you had a chance, Art, to see the budget for foster care? I'm sure you did, the $1.2 million?
Mm-hmm.
Okay.
Yes, yes.
Okay. Now, last year, when the foster care home was built, and it was kind of difficult, of course, to fulfill or even spend the $800,000 that was appropriated to get the building, to fund the RFP and to get all the equipment that was needed. So one of my amendments is to carry over that $800,000 that you weren't able to utilize over to public health to continue on with that. And then this appropriation, like is for $760,453. So what we're doing, there is no jeopardizing paying back $4 million to Department of Interior whatsoever, because right now public health has $800,000 under their belt to run the foster care home. What we're doing is making you whole at the estimated amount of the budget of $1.2 million that was requested to move forward. So by no means, or is there any jeopardizing, paying back a DOI. Let's make that clear. There's no, the sky is not falling. It's going to move forward. There's a lot of people who are going to ensure that foster care moves forward. But Art, moving forward and considering all that you're under right now and trying to move forward, how long will it take for you to get an RFP out and to move forward with regards to the regalo, to the foster care home?
On that, there's an RFP I'm sure being worked on, but Tess Archangel may have more specific details for you, Senator.
Thank you. Hi, Tess. How long will it take, Tess, for you to get this RFP out and get everything else that needs to be done for the foster care to get it up and running? Considering the state we're in right now and the crisis we're in, how long will it take?
We're working with GSA now because there's only one. So probably by next fiscal year, it will be done.
Okay, so with the
fiscal year, yeah.
Okay, and then with the 1.2 million that was in the budget, is that enough funding to for the foster care home to get up and running?
For now, I think it is. That's estimated. That includes everything that's needed for that. But as what our director said, we would not know because like the children needs distance learning, we might need more. So it depends on the needs of the children. Yeah.
Right. But right now, if we were to give the 1.2, the carryover, the 800,000 plus the additional 400 to make you whole at 1.2 million dollars, that would be enough to get it going for the first year,
Yes.
correct?
Yes.
Okay.
Yes.
So there, Mr. Chair, it explains to everybody that the money, if you allow, or this body allows, the 800,000 to be carried over to FY 2021, and this funding, the foster care would be up and running. And as we know that it's already starting with the RFP, they're trying to move forward, but at this point with the crisis, it's making it very difficult. Stephanie, you're talking about the clearinghouse. You mentioned the clearinghouse. I just don't understand how clearinghouse is involved when this DOE, or the federal funding that came for this foster care home, is solely under the Department of Public Health and Social Services. What part do you play in this for the foster care home?
Senator, I was asked to come and testify. I was asked because the federal funds that were used initially to build the foster care home. So I was asked, how would the ability of the program to go forward, would that impact past federal funds that have already been expended? Would that cause us to have to repay it? That's the only thing that I was asked to comment on. Would any shortfall in the program going forward, would that cause us to jeopardize the funding that we already received in terms of having to repay? That's it.
Considering that, Steph, thank you for that, and considering that the Regalo House was built and up and running, and but nothing was moving forward on it, it didn't cause DOE to come back and try and tell us that we have to pay $4 million. But I'm glad to hear that, Tess, that you mentioned the RFP moving forward, working with GSA. I know they've been quite busy with all the procurements that are going on and moving forward, but by no means is there the sky's not falling here. The foster care home is on its way to becoming open. And there are people standing by with donations for the foster care home. What I'm simply doing here is just ensuring that you're made home based on your budget, and then allowing another entity of the government of Guam, our other children that need that assistance to move forward in what they're doing, that charter schools. And it's only the amount that is taken from that is only 200 and something thousand. You get the full amount to be appropriated from this. So again, Mr. Chair, nobody's being jeopardized here on the foster care home. If anybody, I've been an advocate for the foster care home. I've been part of a foundation that has been raising money with the Regalo board, raising money to get furnitures and fixtures, being a part of that Regalo board. And there is no way that I'm doing anything that would jeopardize them. We heard from Tess Archangel that this would make them whole, the $1.2 million, and we're only utilizing $200,000+ to also make whole charter schools that desperately need it. And it's obvious, Mr. Chair and my colleagues, that the charter schools are working because now we have a new charter school that's open and they're getting full. They're really getting full because they're testing. Their students are testing. Anyways, I'll save that for my closing. But Mr. Chair, that's the only question I had. Thank you for now.
Okay, thank you, because I apologize to my colleagues and everyone else that's online. We have to, we definitely have to recess because they have to reset everything. It's almost 5:30 right now, and Senator Moylin, I think, and Senator Will would text me and was asking if we can just go ahead and recess until tomorrow at 9 o'clock, and not unless, and then we reset everything, because I know I mentioned earlier, Senator Taylor will come back at 7 or 8 o'clock, but two of them had asked me that. That being said, and we have to reset anyway, we're gonna go ahead and recess until tomorrow at 9, and I ask everybody, don't forget, you get to close your amendment, Senator Tello, Bonnie Prom, and Banji, Jesse, and if anything, Art, if you can be available in case there's any additional question when we're closing. All right. So everybody, and I want to make sure Art's able to repeat the same statement. We have to seriously reset. They're about to shut us down because they have to reset the system. Okay. We'll see you all tomorrow at 9 o'clock in the morning. Thank you.
Thank you. Thank you,
Have a
Mr.
nice
Chair.
evening. Be safe. All right.